So you have studied Ayurvedic medicine and these years take a major part of your life. Once you become a doctor, you are committed to healing. And to be a great healer, learning has to become a never-ending pursuit in your life. So doctor, what are you doing to continue this learning?
A very warm welcome to all the doctors, students and practitioners for this AACHAARA
learning experience for everybody, even for me also, isn't it? So there is no end for learning. So that's what actually I believe.
Today's subject you are given is psoriasis.
Clinical dermatology.
If you use Vamana on yourself first, then you will believe that it will help.
Spending few hours with a scholar is equivalent to months of time spent reading books. In the name of Acharya Rasayanam, we are bringing excellent minds on Ayurveda with rich expertise in clinical practice. The purpose of this initiative is to guide and uplift the confidence and clinical expertise of every Vaidya. There is a saying, if you cannot be a king, the next best thing is to become a healer, because you are changing people's life, and that is the power of a Vaidya. Acharya Rasayanam is an Ayurvedic practitioners only CME program initiated by Sitaram Ayurveda's 100th year celebration through Sitaram Research Foundation. Sitaram started its healing journey in the year of 1921. Being a pioneer in Ayurveda, Sitaram extends the healing powers through a state-of-art GMP certified manufacturing plant, government approved R&D laboratory, super specialty Ayurveda hospital, and an NABH accredited Panchakarma retreat. By attending Acharya Rasayanam, you will get the opportunity to get valuable insights on clinical practices, various methods and techniques prevalent in the Ayurvedic medical fraternity from the best scholars. You will be receiving the show notes, certificates, webinar recordings, and the latest updates on your email and WhatsApp. To receive latest updates and newsletters, please send a text to 89434 41881. For more details, log on to our website www.sitaramayurveda.com. Acharya Rasayanam. Great practitioners invest in learning.
Very warm welcome to all of you to Acharya Rasayanam with the blessings of all the teachers, our gurus, and all the resources that is providing with tuition and Sitaram Ayurveda as a part of our 100th year of establishment. And today's speaker is Dr. S.P. Sreejit. He is a senior medical officer from the ISM department from the government of Kerala. Now, in order to introduce him, it will be quite boring to read all the accolades that he has had. But if I have to speak from my heart, if anybody of you feels that, there is maybe I need to learn more about Ayurveda, or if Ayurveda isn't really working, spend few minutes with him to understand what is the power of Ayurveda. He is living, breathing, and everything that about Ayurveda, he go to any possible extent to learn it. He has traveled to many physicians, folklore doctors, Vaidyas, and also other non-Ayurvedic, including Siddha, Unani, Yoga, and all the aspects of holistic healing. He goes to every possible extent to extract what is possible to integrate for his patients. And apart from that, even though he has a fantastic practice, the reason why we invited him, I had to take one of my patients to an integrative oncologist of Dr. Sreejit Matthews, about whose experience Dr. S.P. Sreejit is going to talk about today. So when I took him to this doctor, what I saw Dr. Sreejit working as an intern at this point of time when he already has established a fantastic practice. He's working there just like how a BMS graduate during his internship. And that's the power of a seeker. He is constantly learning. And so we wanted to ask him if he could share all the experience that he had with Dr. C.P. Matthews. By the way, Dr. C.P. Matthews is one of the most renowned oncologists who is an allopathic doctor. He was the ex-principal of Kottayam Medical College, Government Medical College. And then after he learned about some of the Ayush way of healing, including Ayurveda and Siddha, he realized there is much more scope for healing beyond what chemotherapy can offer, beyond some of the limitations of modern medicine. And he's a high propounder of Ayurveda and Siddha, and also all the holistic aspects of Ayush. And Dr. Sreejit was living with him for the last few months, extracting whatever possible that we Ayurvedic doctors can learn and integrate into our practice. So today we have Dr. C.P. Matthews, and we are also, in discussion if we could have Dr. C.P. Matthews in one of the future webinars. And all of you, please do check out his website, agnivesha.info, where he documents all the learnings that he has done with many of his teachers, many of his case studies. It is full of wisdom and practical insights. He is a very action-oriented person, not just talking about theory's life. So Dr. S.P. Sreejit, thank you so much for being part of AACHAARA Rasayanam. It's a very honor to all of us. And yes, we will be sharing the website at the end of this. And today the moderator is none other than Dr. Rahul R. Nair, who is the associate professor in Roga, Nidanam. So Dr. Rahul, kindly take over, and we are looking forward for this exciting discussion today.
Thank you, Dr. Vignesh. Respected Dr. Ramanathan sir, Dr. Vignesh, Dr. S.P. Sreejit sir, Dr. Ragesh sir, and all the panelists, respected dignitaries who have assembled here to be with us in this 37th episode of AACHAARA Rasayanam. This episode happens to be a different one in different aspects. Why? Because usually we will be having a speaker who will be going through the different aspects of his personal clinical practice and his victories, his challenges, his failures, etc. Whereas today's webinar is actually focusing on the practice of a legendary clinician. I think one of the most senior living oncologists in Kerala, who have decades of experience dealing with cancer patients. Regarding oncology, we feel that Kerala was having, as well as India was having, a practice which is established through years, but actually now forgot because of the very rapid advent of modern medicine. Many a time when we get oncology cases, we were baffled because of the intensity of the modern treatment, the medical reports, everything. But we forgot the fact that we have got a rich treasure with us. I have got a window to the oncological practice when I was a PG scholar. I was standing with Dr. V.P. Gangadharan, sir, and going through his cases. And at the same time, I got exposed to the works of Mavelikara Kunjiraman Vaidyar, who was an expert practitioner in oncology. And many of his traditional formulations were working successfully in cancer patients, I got to know. So I think C.P. Matthews, sir, is standing at the end of the legendary line of oncology practitioners in Kerala. And today, as in Bhagavad Gita, we note the fact that actually the dialogue was happening between Krishna and Arjuna, but it was actually reported by another person called Sanjaya. So today, Sreejit sir happens to be the Sanjaya of our webinar. He is going to report what is daily happening in the clinics of Professor C.P. Matthews sir. And Dr. Sreejit SP sir, as Dr. Vignesh told, I think he is the foremost of seekers in Ayurveda. I just remember the fact that once when I was a PG scholar in Periyaram Ayurveda College, one fine morning he appeared before us, only to tell that I am coming to stay here for 1 week to learn with Sreeja madam about the finer aspects of Shalakya Tantra. So such was his enthusiasm, and today he is also following the same. So I am honored to be here with the Sreejit SP sir, and I wish him let him take over this session and convey us the very best of the clinical practice. Sir, please.
So I will unmute from the IT team. Am I okay? Is everything, I'm audible?
Yes, sir. Yes,
Yes,
you're
perfect.
audible.
So we will start. We have 335 enthusiasts in the very beginning. I am the reporter, if I may call it so. That is the best way. I would do my best to justify the time and the faith that invested in this program. So the very fact, before we get into the subject, my association with Dr. I'll put the screen share soon, but I think let me start that. That is easier. Before all that, I belong to you. I always did. So it will be very honest conversation. I may not have answer for everything, but whatever is can be honest and point. So let me try to screen share. I would request the team if it is visible. And is it visible?
Yes, sir. Yes.
Yeah, okay. Then I think I should just put in the bigger screen.
Yes.
Now I think we are good.
Please move it, sir.
Yeah, all right.
Once,
Thank you.
please move it, sir. Whether it is moving or not.
Yeah.
Yes, yes.
Now,
Yes, sir. Yes, sir. Okay.
Yeah, okay.
Okay, sir.
Right.
Also,
So
maybe
it all
you can alter your screen a little bit so that
Okay.
your full face is.
Okay. All right. So, well, to start with history, we will get into action very quickly. And I have ensured that there is no one sloka in the slide. Just because we have a mixture of audience, we have allopathic doctors, we have homeo doctors, Siddha doctors. So it's a mixture of all enthusiasts. Somewhere in 1998, I happened to hear Dr. Mathew raving and raving about Ayurveda and Siddha in a webinar organized by AMI. So I was very baffled that an allopathic doctor is raving and raving so high about Ayurveda. Then in 2008, I had the situation, I know him constantly since 2008 and through my father-in-law, Dr. B. Girish, and he's an Ayurvedic doctor also. So that point, I never realized that nearly 11 years later, I'll be very intensively trained by him for 2 years. I never realized that. So in 2008 onwards, I have that association with him, like on off, because I never thought of getting into cancer in this manner, whichever. Then 2019, I just happened to go to him. It was a very special situation. I'm giving the narrative to let you know my association and what the entire back of work is about. So he said to me, like he was 90 almost at that point, Sreejit, 90 vayasai, etra nala naar kariyam. Oh, sorry, for our Hindi and English audience. Sreejit, I am 90, I don't know how long. So you take all my clinical diaries with you. Because once I am no more, these diaries are like paper and that's it. So I felt it's a shame that a legacy is getting burned out like that. So I thought, no, sir, if you let me know, I will start documenting it and we'll create a team and then we'll gather all the information from your diary and we'll start sharing. Because from 2017 onwards, I was involved in the welfare of the 18 Ayurvedic colleges interns on a daily basis, teaching whatever little I know, which I gathered from different mentors of Ayurveda. So we had the channel to get this information disseminated. So that is how the work has started. So since 2 years, it is very intense. And since nearly 13 years, it is the association is strong through different referrals rather than studying cases per se. So I would use the word an introduction very tactfully and very honestly. Obviously, such a huge topic, we would not be able to cover a lot, but the interest for me, the agenda for me is to create interest in the minds of youngsters. My target, if I may use that word, is to have 30 plus 35 plus age group doctors to show interest into cancer's integrated approach. That's my target. And God willing, about if at least 1,000 people are getting into it in a bigger way, then our life is success, professionally speaking. So now we get into action. I have mentioned my phone number, my professional phone number, in case I can be of any help to you. That's a Telegram number. So you will see why I say Telegram later on. So the words are very special there. Integrated approach. We know it's allopathy plus Ayush. And we are focusing on the Ayush, obviously, but we need to know what allopathy does. So next. I think let us start with a gratitude in advance for all the good all of you will do and have done, and all those who are going to save humans in a better way. This lady I met by chance, sister of a cancer stomach patient, she really gave me a hammer on my head in a very nice way. Gratitude in advance is the most powerful creative force in the universe. I think once we start that habit, we will make sure that we get the better version of us for the better of humanity. So Dr. Kalyani, her name, she has a book called Dhyan Baby. It's a language for the fetus. It's a book, fantastic book. So I thought let us start with gratitude. I don't believe in post-paid gratitude. I prefer prepaid gratitude also before we get the things in our favor. Anyway, one word no is enough. For me, he is my mentor, as is mentor of many I know. So we are going to share about 61 years of it. The Agnihotra there has a message. We'll come to that later. It's symbolic. All of us know he is perhaps the only allopathic doctor in record history who has been awarded Lifetime Achievement Award by an Ayush body. So that is itself a bit interesting, and that's a message to the Indian Medical Association also, perhaps. So anyway, I think before I speak about one doctor had asked about my website. There's a professional website. It's there in the bottom of every slide, agnivesh.info. So it's easy. So as you can see very clearly, it's 1954 MBBS, before the state of Kerala was formed. We all know Tiruvidampur, Kochi, Malabar, etc. were the so-called states before the Kerala state came into effect. He had his MBBS in Madras, as it was called those days, now Chennai. So anyway, MS was in Kerala because Kerala was alive by that time, and he had his know about radiation, his diploma in this radiation. So it's all there. Clear cut. Retired 1983 itself from the government of Kerala service, means the Medical College of Kottayam. So last 37 years, he is integrating as much he can. This Ayush side. So that is a background of his, to say so. And I think what I would say very frankly is, as you can see from, we'll come to the subject point blank. I'm preparing the ground because not many people are aware of what the work he has done. So 1954 to 84, as you know, in government sector, documenting cases is not easy. And if you document, it was paper, it was not computer till 1984, whichever. So most of the papers would have gone, that is for sure. But that was mostly the allopathic measure of the surgery, of the chemo, of the radiation. And anyway, the data is unavailable. Whatever is available now is the 8300 plus patients by the integral approach, and the diaries and the case sheets, etc. So that is what I have to communicate to you in whichever way I have understood it. So this is very simple here. The amount of this is just data, plain data. I mean, we'll just go through that. There are a few diaries I couldn't have access because neither he has it. It's lost. Somebody took it. We don't know. But whatever was there has been documented. And then what is happening now is an institution called Charyan Ashram Holistic Center, where he is the senior, or rather he is the chief consultant. And there is where I am doing the live OPD. I've taken leave from government service a couple of years ago because I thought my seniority in the government service or my salary in the government service was less significant compared to the lessons that he has to convey to us and to document it. So anyway, these are just figures. We'll go through that. It has no much significance. Let us get into the first clinical diary. That is, you can see 1983 diary, but the cases documented are from September 1984. After his retirement. So we have like 37 years now almost. So just a symbolic one. So I would use the word cancer care also, and not just cure, as you can see that. So this is a center where he works. I'm sharing this just in case if somebody has anything to engage with the center or with Dr. Mathew sir. It's in Malayalam, of course. It's a newsletter that they bring out at a cost of just ₹3. To patients who are the approach for his healing and his help. So every credentials of the institution is shared here very clearly. And as you see in Malayalam, the pink highlighted area, Lifetime Achievement Award. So whatever, that is just to tell you, because for me, before I start the subject, the Guru Vandanam is very important. The center is my Guru, obviously, where the patients come. And of course, the mentor is obviously a guru. So let us start with that. Now we get into action. But special thanks to these three fantastic professionals, Dr. Anjana Rani Nair, Dr. Adiras Ravi, Dr. Nihal S. You will see them later on, but there's something called Mission Revival that you can also profit from. It's a YouTube channel which has all the important lessons in video form. So yes, now we come to the current reality. The fact of the matter is the field of cancer treatment heavily depend upon allopathy for multiple reasons. Simply the sheer number of patients they get across or come across, the infrastructure, the diagnostic needs, the follow-up needs, so much of things. So that's a reality no one can forget or ignore. I would use the word dominated, and the word is a bit negative in that sense, if you may take it that way, but it's a fact that many a times, and I'm going to not mince any words, we will always believe we speak orange is an orange, we don't say it is an apple. They do create a situation where they make other systems very minor. That's the word I would use. I have a lot of experience facing that kind of socio-medical reality or strategic reality. So this has to be kept in mind before any young doctor gets into the cancer treatment aspect. There's a huge financial burden. All of us know that our methods in Ayush would cost hundreds or thousands of rupees. In the allopathic sector, it would be lakhs and lakhs. We say in Hindi, girvi rakhna padta hai, where you have to, we may see in our language here. We really kind of have huge financial liabilities. That's the word I would use. Unfortunately, the realistic cure prospects are unknown to the public. This is also a reality. Like, okay, if the disc herniation patient, we would say itne time in this much time, this much leave, this much symptoms come down, this much cost. We have a predictability in our general practice. But obviously, we can't predict that in terms of the oncology, psychiatry, or the infertility aspects. So this is also one thing. The cure prospects are not fully possible to be conveyed by the doctors, and neither the public knows about it. And this leads to a lot of confusion, unfortunately. And Ayush doctors do not realize their strength. The elephant doesn't realize his strength. The same way is the situation with the Ayush doctor. This is what I've understood. So when I say these respected doctors, I must comment to you that on a nearly daily basis, I am engaged with more than 2,000 doctors through different groups by whatever contributions I make or vice versa. So there's a lot of interaction, and I have very close connection with medical officers of 14 districts. I have a certain group I have organized. So there's a very clear pulse I have about what reality at least Kerala doctors are having, be it the 14 districts of Ayurveda government medical officers, nearly 1,500 of them, or be the Ayurvedic colleges, about 18, 19 of them, the interns. So that gives me a clear feel of how the thought process is, and I have realized very point blank over the months, we ourselves do not realize our strength, and that's a shame, and that's a thing that we have to improve about. And there's no single clear winner. Integration is the only way out, and that's what Dr. Mathew sir would communicate point blank, time and again. So where do we play a role? Because if a cancer patient is approaching you, you have to tell him or her that this is what I can do for you. And that is very, very important. Unless the people feel very point blank that yes, this is what he can do for me, they won't be giving their life to you. Because unlike other diseases, the panic button is very high in cancer. We have people injection fraction just 15 or 20. We have people with dialysis being happening once a week or even twice a week. The Krichra to Yapya to Asadhya, we do face quite a lot, but when it comes to cancer, the spectrum is totally changed. There's a panic button, there's an emotional button, it's very, very intense. So for that reason, we will have to justify the time, money, and faith somebody is investing on us. Itne time mein, itne paise mein, itna kami, itna behtar. Now, this kind of narration, we will have to communicate to the patient. It is possible. It is possible to a fair extent, if not fully. So the primary aim, let us be frank that we are not treating Sukha Sadhya. It's out of question. And even maybe Krichra may not be also the case. It is invariably Asadhya, invariably, for multiple reasons. So improving the quality of life is what people think about. And why we have a point there is that when it comes to the allopathic measures, which are great, with all respect to allopathic doctors, no offense intended, the expense is Herculean, lakhs and lakhs. I'm a government service doctor, so my pay scale, I'm not in service now. I've taken leave for this specific assignment. But I would earn like typically 95,000 rupees in my seniority. I joined government service 2006. So say 1 lakh maximum. I know one injection of immunotherapy can cost more than 1.5 lakhs. If a government doctor like me can struggle for meeting the expenses of cancer, and mind you, this is not the hospital stay, this is not the doctor fees, this is not the investigation cost. I'm talking of one injection, point blank. How can I expect a private sector person or other types of people to afford it? So when we compare it with the quality of life, our cost is much lesser compared to the allopathic side, the quality of life aspect. And then of course, because when you try to sell an idea to a patient, I mean, sell the idea not by money wise only, but the ashayam, the message, you have to be buyer oriented and not seller oriented. For that reason, this is the first thing that you need to communicate. Secondly, obviously, chemotherapy is happening, radiation is happening. So post chemo, post radiation, the body is virtually roasted. You call it not only Vyadhi Karshitan, you are like Bheshaja Karshitan also in a CA patient. So that's really a tough situation. And then when surgery is not feasible, we know surgery is needed, but it's not feasible, or the patient is not willing for surgery, they want to give a shot. And of course, least but not the last, last but not the least, the avoiding financial tragedies. That is huge. I have felt it a number of times, the financial challenge. So ultimately, we wish to convey to the public these 5 points where we have a say, where we have a lot to contribute. So unless any practicing doctor knows what he can do and convey it, the patient doesn't believe you, obviously. So I requested Dr. Vignesh today, kindly don't read my CV. It doesn't matter what my credentials are, what my experience is. All that matters is how I can be of any help to you now or later. That's all that matters. So our biodata hardly matters to anyone, or neither to me actually. So what I would be trying to share in these 1.5 to 2 hours, whichever time we have now, is the tricky diagnosis scenarios. Of course, there are ready-made point-blank diagnoses we know, and also the commonly adopted strategy, what Dr. Mathew said is usually using, and prescription-based screenshots wherever it can be, and follow-up screenshots of how improvements have happened with the patient. So that is all that is important, because unless it is documented, so we are not talking about peer-reviewed journals and such kind of very interesting and seemingly elaborate details. Patient just cares that he or she gets improvement. They're not worried about even the CT scans, MRIs, or the PET scans much. They say that anyway, my days are limited. Let me have a decent farewell and a smooth farewell from this world. This is what majority of them are into the psyche of it. So that's why it's very important that we prove to them, you came me with this, and now you have this improved. We'll see that how it goes. So these are 4 agendas I would have now throughout the webinar. Tricky diagnosis coming soon. So here is an interesting situation. There is somebody who is limping, and limping for more than 2 months. Obviously, we all have an intent that if we give a medicine to any patient Ayurveda, I mean, acute things would respond acutely, I understand, but chronic, we say, from my government experience, I have seen out of every 100 patient, nearly 85% would say, doctor, പഴയ പ്രശ്നമായിരുന്നു ഒരു 3ാം പക്കം 4ാം പക്കം ആയപ്പം കുറഞ്ഞു തുടങ്ങി. Oh, sorry, we have, it says, doctor, it's a chronic problem. By 3rd to 4th day, I started finding a relief. So we all know that. So typically, if the diagnosis is pakka, if the quality of medicine is very pakka, very sure, then we have a possibility that we see the results happening in the first week itself, mostly, not necessarily always. So by 2 weeks, you should feel, Aachi is a colloquial in Kerala language, is like, no, kuch to aram mila hai, some relief. So when it doesn't happen, for more than 2 weeks, we started suspecting our diagnosis, then we start suspecting our medicines, and then we start suspecting if the patient has really taken the medicines. You never know who is bluffing you. And then lastly, we think, kuch to missing hai. In 1 month time, it's already too much. 1 month is too much. You can't wait people to wait for that long. So for that reason, this patient, as you would see, limping was a scenario. And then one doctor, it's not my patient, the patient came to us later, but this was diagnosed already. He just felt like giving a chest X-ray, and you see the lesion very clear cut on the left upper lobe, very clear enough. Arrow of the arrow is very clearly there. So this is tricky. It was Mets. All of us know that. We all know this reality, but then the problem is we may not suspect it prima facie. So this is one example. Same patient. It's more than 2 months, I should 3 months, and due to the lytic lesion of the femur and the red pen, I keep the red pen because whenever I'm in the OPD, a part of my soul is with the Ayush community. I just learned something interesting, at least for me, something new or interesting. I just think, come on, this should go to 2,000 doctors at least. That's why, because I have taken more than 18,000 pictures, like shot after shot, the OPD shots, more than 18,000 pictures are with me, all the documented. Some of them repeat. So I make sure that put a red pen or a green so that I know this is the one I have to share with the groups. That's how you see the red pen pointing towards FDG avid bone lesion, right femur very clear cut. This was causing the limping. What is the point of doing LKD there or Patraportal Sveda or thinking of it is something related to ortho related? No point. We don't have chest X-ray, we are done. So this was simply a secondary of the, CA lung was the original part of it, and then the lytic lesion femur so evident. This is one tricky thing. Secondly, somebody, as you can see on the screenshot, is very self-explanatory. Swelling the legs, 40 kgs increase in about 7 months time. Extension dyspnea was happening. Somebody said, come on, go for a scan. And here we have adrenocortico cancer. So the point is, dear doctors, I'm not claiming that Ayurveda has a clear viewpoint for adrenocortico cancer. I don't mean that. I'm not claiming that either. We may have caught it by Nadi Pariksha if somebody is that skilled. Not all of us are perhaps into Nadi Pariksha all the time in a big way. But then if we miss his diagnosis, we are done. In today's world of hyper consumerism, and rightfully so, if we miss that. So this is why I wanted to make sure that more than treating somebody, people appreciate you more for your diagnosis if you don't even cure them. Chalo, he made the diagnosis. Chalo, I took the decision. I was given advance warning. This is what people would generally think about. So I'm just putting this. So there are plenty of such screenshots that are shared regularly in the group. You'll see that later. And as you can see, the gentleman from 75 kg, he shot up to 105 kg at 7 months time. It's gradual, but then this was the reason behind. And it's actually, we have a form that we request them to fill. I've highlighted the pink area, you can see it very clearly, and he did even surgery, etc. So I don't claim that if he had come to us before, we would have cured him, but at least this is one simple idea. Again, very commonly found. Kept on treated for piles was CA rectum. And can you imagine, as you see below on the green shade, green highlighting, for 10 years, piles in the Vijayarichu chigilsichondirunnu. Vijayarichu means sochte raha. I thought it was piles. This is patient's narrative. And then, for the 1.5 years, there was a flare-up, a lot of bleeding happening. And then he just fell unconscious. Blood loss, XYZ, hospitalization, and then his CA rectum. Hell. So there, Dr. Mathew always says, if you don't inspect the rectum, the judiciary will inspect you. That's the way he would say it simply. So this again, one example of how we need to be so careful about diagnosis. Treating is a piece of cake, like you have a clear protocol, that's not a problem. But coming to the conclusion, not missing the diagnosis, very, very important. And as we spoke about the diagnosis, let us share some prescription shots, because ultimately, what do we carry back home today? What messages you have? I have made it the pink highlight, then the white highlight, and then the green highlight. As you can see, the lady 53 years. And she's of course CA breast, because you see the tamoxifen 20 mg. That's compulsory for Dr. Mathew sir for 5 years once, even if it is hormone negative or positive, he is very particular, it has to be given for at least 5 years. So I will come to this Ashwagandha twice, of course Churna. Purna is Purna Chandrodaya Rasa 1 BD. Rasa Sindura is we get in capsule form anyway. Plenty of companies have it. I'm just showing how his prescription is, because ultimately, if we don't get into this prescription basis of learning, I mean, when I train these young doctors in the 19 Ayurvedic colleges for the last now 4 years now almost, I tell them, boss, you are rank holder, you are best of the best, all said and done good, but boil down, knowing prescription of at least 300 commonly found clinical conditions of clinical practice. If the prescription recipe is not ready, boss, all your exams, everything is gone for a toss. So I think we should have the prescription clear cut. But there are more coming. I'm just sharing like that. This is how we document it. And here you see a gentleman, CA prostate, liver mets, 2.5 years, 65 age, is not responding to any allopathic therapy. And the PSA is increasing and increasing. And what can you do? And he came, as you can see, it's just that those who are not from Kerala, the language is Malayalam. It's our language that you see. And on the center, there's an arrow which shows, it's called Marina means medicine. And then 15 April, you see 2021, PSA 24, whatever, 15/5, and then 5th of June, 26th of July. You see that below. And you see how the PSA is falling down and down and down. Well, we all know PSA is not just the golden standard for CA prostate. We all are aware of that. PSA will increase in many conditions. But then, people relate to the symptoms. They relate to the investigations. So in this case, Purna Chandra, that's what you see in the red circle with a yellow arrow pointing towards it. You have Shiva Guliga, the second. You have third Rasa Sinduram. You have Shirajit capsule. And you have Rasagandhi Mediga. Because this is patient's handwriting. So this is how we take the screenshots when they come repeatedly. And the symptoms are very clearly there. 2, 3, 4, like Malabandham, Orkakoravak, Shinam, which means constipation, insomnia, tiredness. Because when the patient comes to you, you have to prove that something is happening or not. You can't wait for the patient to wait for 3 months to prove it objectively, PSA or PET or whichever scan. You have to start making the patient realize that you have come to me and first week itself your symptoms are behaving good. That is very, very important. Otherwise, the patient after 2 weeks will just abandon you. So we make sure that they realize they're improving. That's why this feedback system is there. We'll come to that later. It's just to show a certain prescription. And the most important thing, the most lovely part of the many lovely aspects of Dr. Mathew's style of practice, all these medicines, he makes none of them. He just prescribes. So anyone who has intention to practice it, just with the prescription paper, they can start practicing. Everything's available in the market and easily available. No secrets at all. And it's another prescription. I put a certain condition that CH service advanced. And these are our real life OPD case sheets, actually. All OPD, all those already improve Agni, Excel to save lives. Kindly excuse me, it may be a repetition for you. So you may abandon the webinar if you wish so, because some things will be repetitive here. It has come in different groups already. Yeah, all these have been shared with 2,000 plus doctors many months ago, but maybe it's a revision for you. So here you see that CA cervix advanced. So all these patients, they are like devastated financially, devastated psychologically and body wise also. And you see here, I have put in blue, the 3-hour dose in blue highlight, red circle, and then you see the pink Sudarshan tablet, I wrote in Hindi, Sudarshan, and then Hinkojadi, I wrote in Hindi, and tab 111 like that. So as you see, the patient told much relief after 2 days and almost nil pain by 7 days. And mind you, these are patients using morphine, etc., not helping. I don't say that every time it helps. I won't claim that. But then what is the cost of tablet Hinkojadi? 3 rupees or 4 max, maybe 2. And what is the cost involved? And we know that it's a fantastic Amahara anyway. The Kapha Pitta aspect comes from the Sudarshana and the Vata Kapha aspect comes from the Hinkojadi. So it's like Dosha kind of Ahara kind of a scenario. And as you can see, relief after 2 days. That's why I say that itne time mein itna kam hoga, we can't say all the time. But most people, I don't know how and why, even chemo, I'm baffled about it. I don't know if the Jesus Christ Lord, resurrection by 3rd day, if that is how we also following. I don't know what, most of the patients, they say, by 3rd to 4th day, I feel a shift, but not everyone. So this is how you see very clearly, it went to the extent, I'm coming to a very important name, Dr. C.D. Sahadevan sir, my mentor of many of us. I'm a student since 2004. I'm very blessed that he guides me regularly. So you see there, the lady got overconfident by the relief. Somebody was devastated and she wanted to discontinue the tablets. That was the kind of confidence she had. and it's very clear cut. You can anyway revise it. And the pain was constant all the time. It's in Malayalam, it's wrote there in green rectangle there with the red pen pointing that Vedana Karanam Nerate Eppozhum Vayar Pidichirikkuvairunnu. I use the exact words of the patient as it is, because it is very difficult to convince a cancer patient that we are taking your video. They ask whether it will put in Facebook. So why should we make them feel insecure in the name of gathering evidences? It's not fair. So that's why I wrote everything exactly the words like this. That's why the case sheet becomes too big, writing the narrative. And here the Sudarshan Hingwaje tablet, that is what made the impact. So it's just an example of different screenshots. When it comes to hepatic and renal challenges, Dr. Mathew sir trusts and refers patients to an Ayurvedic specialist. The community of Ayurveda calls that doctor the top gun. And in fact, I coined that phrase way back in 2004, the top gun. He did not like it, but I said, sir, that's it. I have traveled the entire length of Kerala. I've been of the best. I'm eternally grateful to all my mentors, this lifetime and beyond. And I'm not comparing my mentors. It's like comparing who is more important, your father or your mother. So it's just insane and impolite and uncultured behavior if we compare. But I must say the top gun comes here. By virtue of the widest range of applications he uses with very common drugs and uncommon indications. And at least from Kerala Ayurveda, I would say. I'll come to another legend, another great Vaidya, Dr. Tapan Kumar sir. I mean, he calls himself Vaidya Kumar, but of course, I would call him Vaidya, Dr. Tapan Kumar sir. Because in Kerala, you know, Vaidya itself means you're not a graduate of Ayurveda. So that's why I want to make it very clear. He's a proper Ayurvedic doctor. We'll come to a great legend later. But from Kerala, at least I can say. There may be more legends. I acknowledge that, but I don't have direct contact. So that's why I'm not putting their names here. So here comes another situation, which is the patient wants to avoid surgery of the colostomy bag because it's a scar in their mind. So this is the kind of scenarios they come, and there you see the first pink highlighting Chenninayagam is a Katti Chenninayagam, which is actually aloe vera dried. Simple as that. Black color it would look like. And Nellika Valipam means Nellika in Kerala is Amalaki for our non-Kerala audience. And that is typically size of Amalaki. It is a must. Dr. Mathew sir, for him, C. rectum means Chenninayagam has to be there. There's no second thought on that. Even if you have constipation or not, he doesn't care. He says it's a fantastic anti-inflammatory effect as a great healer also. So that is that. Some people vomit, I understand that, but there are ways to get inside. And you also see the highlight of MTX is methotrexate, 100 mg, fluorouracil 1000 mg, you see that. And the cost you see, it shows on my screen that internet is unstable. God forbid if something goes wrong, we'll figure it out. Just that will let us know the audience. So it's like rupees 350, you can see that. So that is the low cost of his chemo methods. Well, as thing would have it, I'm not foul-mouthing, but many of the allopathic doctors and their chemo lobby feel that Dr. Mathew sir is outdated because his chemos are, I don't know, is that the complaint? I do not know, that it is not expensive or I don't know what, but I see the results very point blank at a very affordable cost. So anyway, I'm not debating on it, but I'm just putting a third party opinion to it. Anyway, you have this kind of screenshot, very clear. Mine is not moving. No. One second. Yeah, I think now, yes. Now, how do we see the follow-ups is the other thing. How do we evaluate it? We saw the diagnosis, special things, and the prescriptions, just samples. We'll come to all that later. This actually, the entire prescription narrative of Dr. Mathew sir would summarize in about 25 drugs, I would say, nearly 15 of AYUSH kind of, and the chemo 8 to 10 kind of. So that's all that, because we need to get to that, what he does and how he does. So here you see a patient, multiple myeloma, but the symptoms are what they are. Ochaadap is number one for our Kerala, outside Kerala friends. Ochaadap is like hoarseness of voice. Sheenam is tiredness or fatigue. I won't say klama, it may be too much bigger and adivyapti. Then Vishapilaima is like lack of appetite. Kai Tarip, Kai is hand, Tarip is like numbness or that kind of neurological deficit. And Kalvedana is leg pain. So as you see, this is one of the rarest of the rare where from day one or every week, every symptom is behaving in our favor. And respected doctors, please bear in mind, all these patients come as a last hope. Can you imagine that? End stage, useless, devastated, given up. In spite of that, such chronicity, Vyadhi Sangara, whatever, the results are happening and happening with very simple OPD medications. And this screenshot that I have is a paper that we give to the patient and they take back home. And they write and they keep sending me screenshots every week. So my learning of the last these many months has been this kind of every week, even if I don't see them, I keep knowing from them because I know which symptom is behaving how by virtue of the narration. So this is very important that you also, if you get into it, make a habit of making it, let them document and let them keep sending screenshots. Another one, gone for a toss, flop, CA sigmoid, lung liver mets, it doesn't respond. You see the green smiley part is nil, and the red frowning or upset is we lost it. So what to do? So this is also a possibility. And there are people who improve and not improve kind of situation, 50-50. And this is another example of a CA lung, was advised for radiation therapy. But can you imagine 31 kgs only? How can you stand the radiation and other things? Sometimes more than the Vyadhi, the Aushadha or the Chikitsa itself is like going to bring the patient down. This is where Dr. Mathew sir gets AYUSH into action. He strongly feels that, boss, even if you don't make better, why do you make worse? And why do you create financial liability? Anyway, patient will die, God forbid, within the next 2 months' time. Why do you cause financial obligation? I mean, I can't put a price tag to any human life. So please bear that in mind. My intention is not to say that financial, for a human life. But then the practicalities of life come into effect. So this is one example. As a last example now, before we get into action. The follow-up screenshots is a lady CA right breast, and how you see how her symptoms are improving fantastic. She's grandmother of a Ayurvedic doctor, young intern, and all the symptoms you see, it's the intern who wrote the symptoms for her grandmother, and CA breast was meant for surgery at the age of 70. And Dr. Mathew says, for God damn sake, why do you get a lady to knife at the age of 70 when we know CA breast is a better curable entity? Why do you create a surgery and then have metastasis after it? So you have to imagine the condition that they come. This is socio-medico financial background. They come with this kind of absolute tormenting feeling. And you see, you see on the green side, the symptoms like breast hardness got better first week. Lesion size did not, it also responded first week. In the right armpit, the wheezing getting better. But the relief that did not happen, the right hand side, I have not marked it. It's number 5, which is severe constipation, and number 6, which is the fatigue. So that after a while, when you get feedback after feedback from different patients, it's like, so what I am speaking to is a data of 6,300 plus doctors, patients actually, data of that. And more than that, it's more than 2,000, that's with inclusive diary that I have with me, that was gifted to me to maintain his legacy. I don't know if somebody would ever read those things. So I am getting into digital format. But what I have seen, more than 2,600 patients in these many 1.5 months, nearly 500 days, last 500 days in his OPD, leaving away my government job and everything, whatever. So this is the kind of feedback we get to know that after a while, by God's grace and the teaching by these patients, it's all their merit, not our merit. We may tell that, okay, these symptoms would behave in these many days only. So, Thandrak, aram se, please wait and give us the time and the possibility to get you better results for you. So that is how we will have to convince it. But they're highly freaked out. Obviously, yes, when death is staring at your face, you'll be freaked out anyway. So that part is very important to maintain their confidence and morale. It's very clear cut. It's English, so it's point blank. So anyway, we should not forget the people who have organized this. I am standing in front of Dr. Mathew very clearly, and then this gentleman in French beard, Shri AJ John. He is the visionary behind this setup, admin setup, logistics. We have Dr. Marcos, allopathic doctor. We have Dr. Amintran. He's a Ayurvedic doctor there. You see Madam Jasmine, who has been part of the journey with Dr. Mathew sir, with the patients follow-up, etc., as I do also. And then the better half of Dr. Johnson. I mean, I'm very grateful to this family. They allowed me to work as the intern. Of course, I'm not on the payroll of the place. Let me be very clear about it. I'm not making any publicity to this place. Let me be very clear about it. I'm not on the payroll of this place. It's my total voluntary initiative. I wanted to learn. I wanted to document. I wanted to share. And I wanted that more doctors, wish, more doctors get into it. So kindly don't take it as a publicity of this place, not at all. So how do we deal with this situation? So these were the things that are the normal activity there. So there is a patient management aspect, and there's a disease management aspect. We have a godlike personality, Dr. Muralidhar Sharma sir. I have never met him, but every day in my prayers, I pray for him. He won't know it, he doesn't know it. And I learned this aspect from him, the patient management and the disease management phrase. I learned from one of his webinars. So it is very important that the symptoms of a patient is what we would call the patient management, how they respond, because that's more tangible and more easy to know on a very weekly basis. The disease management is a strategy. I'm going for surgery, going for chemo, I'm going for radiation, or whatever it is like. So in the patient management, needless to say, Pathya Apatya is very important for Ayurveda, and Dr. Mathew sir is very strict about it. He says that vegetarianism is very important. If you don't have vegetarianism, don't come to me. I mean, not that explicitly. He says very stern and clear and politely. So that, of course, we all know the Pathyam we follow, but I'll share the screenshot, and we need a symptomatic relief. No patient cares about peer-reviewed journal when it comes to cancer. They say, like, kaise bhi bacha lo aap. That is the intention. Just give me relief. They don't care whatever it is. They say affordable cost and reasonable improvement. Kal ka kal. Who knows that tomorrow the patient is there or who gets a cardiac attack? You never know that, cardiac arrest. So for that reason, symptomatic relief is a very, very important idea. And that's why these screenshots we have shared before, and also the suitable strategy, disease management, what is to be done. And in this comes the idea of whether it is Ayush, whether it's chemotherapy, whether it's radiation or surgery needed. The decision making is the biggest challenge. We have so much information, the Google and elsewhere, Yahoo, whichever search engines. But when it comes to credible, actionable intelligence, experience-based, many people beat around the bush, at least in the case of cancer. To make an informed choice, to make a clear-cut plan, it's difficult unless you know what the other system can do for you. So this is just an example. You see my professional number there. So all the patients are given the list of do's and do nots. So it's sent in Malayalam because 99% of patients are Malayalis anyway. And I have included those aspects. So with this phone number we send to the patients. They send this screenshot of their paper that they carry from us. And we make sure that we request them that they may please take printout of the 3 parts. It has everything that we think is very important. So this was prepared by me, and I am in contact with Dr. Mathew sir more than 10 years now, nearly 13 I would say. So I proposed him, sir, is it okay? You are telling Pathya Pathya, I know, at your verbal level. May I make it as a document and then share it with patients? He said, point blank, very welcome, because it makes his task very easy, saves his time and so much so. So these are 3 parts we have. I would, because when you say the word Pathya under, they are like, Doctor, when we tell them to be vegetarian, they say, can I have the fish that is cultivated in a neighborhood? So that's a kind of enthusiasm they may have. Then they say, when we say to vegetarian, they say, is it okay to have Nadan Kodi, which is like village hen instead of broiler hen? So these are kind of tricky questions they ask. So we say very simply, we don't use the word Pathya Apatya. We say health improvement techniques. So then it sells better. Your idea sells better. So Pathya means it's like a taboo. In Kerala, you say Parez in north of India, they get upset. So why to make them upset? We say health improvement technique. And we also say, if you really want to have the best impact, go by this. Otherwise, the medicines and the time and the money you spend on us is a waste of time. So they really take it serious. This is how it's part 1, part 2, part 3. But what I have done here, and the compilation, I'm very grateful to Dr. Shamakrishnan Sir, my mentor, Dr. G. Shyamkrishnan, I think Sitaram Institution definitely knows about him. I'm very thankful to Dr. Ramya and Dr. Ashtamgam of SEBA. Some aspects of this have been imbibed. And one certain Dr. Girish, who is dealing with skin conditions. So I've compiled all the lists from these fantastic doctors and made it in such a manner that it encompasses aspects of Ama, Vidagda, Vidaha, those all group of Shobha, multiple entities to be kept at bay to have the best healing environment for the medicines to act better in the body. This is how all that, this is very, very, very important. So it can be shared by WhatsApp, whichever somebody needs it. Everything's very clearly mentioned there. So what is happening is the reality, what Dr. Mathew sir does and what is the cost involved. Of course, we can't be 100% precise, but we can be reasonably precise. Is he has chemotherapy regime that can cost you minimum 300 rupees to maximum 3,000 rupees. It depends upon which is what. Methotrexate is very cost effective and mitomycin obviously is very costly. So this is the cost involved. Radiation he doesn't do now because it needs a hospital setup. He was doing it left, right, center. So that will cost in a private hospital something like 3,000 to 5,000. Because I tell these facts to you when somebody is approaching you, you can always say that, look, I know the fact that when you go to allopathy, this is the cost you will have. And please bear in mind, when you come to me, the cost would be this much because people are money sensitive and they're rightfully so. Surgery, of course, varies upon the surgeon, whatnot things to it. The Ayush medications of his would cost something between 3,000 to 6,000 per month, an average kind of. The 6,000 comes up if Siddha Magara Dwaj comes into action, which we all know one capsule would cost of cortical. I have nothing in favor of cortical, but easily and more easily available. We also know that Doodh Papeshwar also has it, maybe nearly half the costs. And we have great quality from Siddheshwara Herbals, great quality, Dr. Shashikumar Nachil sir. Nearly half the price. So, but then cortical is more easily available. So it can go up to 112 rupees a capsule. So that's why this difference comes in. And then I put 3 star marks, talisman. It may sound a bit weird for a medical presentation. We're talking about talisman and yantra, but I am very convinced by virtue of the experience I have had with his patients and his experience, of course. So talisman is also a part of strategy. I put the word varies. It just depends which Jyotish, which Tantri or which professional you're approaching. And so we can't put a price tag to it. That's why I put it like varies. Now we come to the theory that all of us know. I was not very interested to keep this slide simply because all of us know that. And it's self-explanatory. I should not waste your time into this. Caution, I have put the first word and this is so clear cut. Many people, bowel habit changing, they think it is diarrhea, they get treated for Grahini and then you end up having CA colon. And many don't even care the change in the bladder habit. We never realize it's CA bladder or CA prostate. So many people keep on denying, they keep putting XYZ creams, doesn't get better. Many ladies post-menopause, so shy to say of an unusual bleeding from the, per vagina or even discharge for that matter, they feel so shy to say. I even had ladies as young as 45, like, so-called educated and, who kept this hiding and they ended up in CA cervix. And of course, a lump or that is more noticeable. And swallowing difficulty, we also know that. There are many people, they carried for a long time. They had the food in 3 to 5 seconds, ulta or ulti. And they just thought it's okay. And somehow they have a bit of water, hot water, like puttu. Puttu is something Kerala delicacy, like it's a bit dry kind of thing. You need a bit of water to push it down. So they don't even realize that they were in the beginning of CA esophagus if they belong to a certain class of society where education is not great or if they don't have much of awareness. If they don't have much of awareness. So these are all very simple things. And cough, somebody carried cough for a long time. They thought it's bronchitis and then they end up having CA. So it's all common things. Many times we can detect, but I wanted to make sure that I share with you something that is not textually explicitly found. Thus I made those unusual symptoms to be shared in the beginning than this which we had already studied in final year of BMS anyway. And this is what he does typically. History taking is very important to him. So one patient may be consuming about 20 minutes of his time, at least maybe half an hour. History taking, the inspection, palpation, because of course, most of the time it's diagnosed. We know that it's diagnosed. However, you may miss a simple Virchow's gland, supraclavicular, CA stomach. You may miss a node somewhere else. There's so many things that you may miss. So palpation has a role if it is socially possible. There's a limit of how much you can examine people sometimes. I understand that. Of course, tumor markers, all very straightforward, very straightforward. Dr. Mathew sir is not a great fan of PET scan, even though it is fantastic, but he thinks that when there is a cancer, they're all over the body anyway, because we all have cancer cells anyway. It's just that they are activated or not activated. So he laments the fact that already such a much amount of financial liability and tragedies happened. Why to spend more on PET scan that is 25,000 or 23,000 rupees? So he looks it that way. But anyway, in today's world of evidence and follow-up, it's a tough call to take. So we just have to accept the fact. Now, one example. This is a patient who was treated for Crohn's in Vijayarich. He was being treated for 5 years. And Vijayarich means as considered. And then it was sigmoidoscopy, extra diagnosis, everything happened. When the bleeding started, they did that and like whatever. Anyway, you see all that. There's one Tangachan Vaidyan who is also into oncology, in whichever way he thinks is best. And then, I have nothing against Tangachan Vaidyan. I mean, every individual in the earth wants betterment of the people. It's just that they may lack certain awareness sometimes. Just as I lack a lot of awareness, I'm also limited like most of you maybe. So I have nothing against the gentleman. Everyone's intention is good. But the modern diagnosis helps many times. So when the patient was apparently doing good for a while from him, and then Nair, you see the low albumin level highlighted red ink, but highlighted in pink. And before that, you see something called in Malayalam Nair Mokham Urmastholam. Mokham is face, obviously. Nair is like watery edematous, low albumin level, and Tangachan Vaidyan couldn't help. Obviously, he doesn't have the allopathic side of it, which we have because of our training. So nothing against him, but that's a reality. So he said, no, hands up like that. But the fact of the matter was that it was low albumin. Infusions did the trick. So what is the point of having Mandura Vadagam and Puranavadi Kashayam thinking it is Shobham when we know we may perhaps get maybe similar result by Mottavella, that is egg white with black pepper added to it, or even Haritaki Churna with butter, thanks to Dr. Rajesh Shenoy who taught me that, or even Bhringaraja Rasa. Anyway, I'm not getting into those prescriptions, which are also albumin increasing, but we need to be competitive. We know that there's edema in the feet and the face, and when we have a possibility of an albumin infusion, why not get that done and get the albumin shoot up in 3 days time, when our medicine may take a day or two more than that. So this is my point here, that modern diagnostic knowledge definitely helps. So we have to be very point blank about it. Again, tumor markers, let us rush through it. Is there in the PowerPoint? You'll see the recording anyway. Let us not invest our time on it. Dr. Vignesh would be surprised, but anyway, it is very important that we thank people who help us to unite. And they both have a mission, they love it, and they live it. So I think as we proceed ahead, we must keep in mind that there are like-minded people who wish the welfare of Ayurveda. They are well placed, economically well off, they have their comfort, they have a big pharma, whatever background, but they think for other doctors also. And Dr. Vignesh had come to meet me with an agenda that he wishes that we reach to more young doctors, that we empower them financially, we empower them knowledge-wise, and we create an ecosystem which is a win-win for all. So I think we must thank subtly in our mind and heart, and we proceed next. So once upon a time in Kerala, 1984, this is what I would say the thing started. 1984. You see that very clear cut. As you see, you find 31st of August got reply saying patient is doing well and better. And you see a very clear mass below the rib cage, the liver area, very clear cut. So I'm telling you that there were Vaidyas who were doing it, but Dr. Mathew sir took the next step to link to them. Just a proof. So before implementing Ayush protocols on a cancer patient, we should be aware of our scope, of course, our limitation, of course, and more importantly, I would say the word more importantly, the scope and limitations of allopathy. And this is what I'm going to communicate next. In fact, the importance is that I know that you will get these things in allopathy, and this is what I will offer you. This narrative has to be brought into the patient's mind. So in that case, even if you write Gomutra, after you tell all that narration, they would accept your prescription because they are confident about you. The confidence comes when you know the other service provider does what, or what he doesn't do also. I would use the word competitive efficacy. That's the word. And this is what I've been trying to train these doctors. Now there are nearly 750 of them in 3-4 different groups of WhatsApp, last 3 to 4 years, 4 years actually. Let us put it this way. As you can see, the great impact of chemotherapy in lung cancer. I'm using the heading, when to do chemotherapy. As you can see very clearly, everything is highlighted. The name of the patient is hidden. 11 March 2020 and then 21 September 2020. And you can see on the third item with the red pen pointing, that's how I take the photograph in the clinic, how it is written regression of the right lung primary. And on the left hand side, you see the previous scan mentioned as a comparison, the big mass shrunk. So my question is, well, as I'm still a learner in oncology, I accept that fact. I'm very humble about it. I have no second thoughts about that. I have a lot to learn. But if a patient asks you, Doctor, can you give me this kind of impact without chemotherapy? We have to find answers. So I'm just sharing that to you. It's up to you to judge. So this is the kind of documentation we would need. And you see the very clear cut. However, now you will see the duality in me. You will see me as a double standard now. I will start my double standard behavior now, deliberately. The duality, that's my experience, so I'm double standard with that specific narration further on. Agreed, chemo is great. And you see this lady, I mean, in the OPD itself, she's like already slept or rather devastated. Such bad effects of unnecessary chemotherapy. That's a word there. Metastatic CA, ovarian CA. So Dr. Mathew sir says, I know chemo is great. I also do it. But we should at least look into the patient. You should have the common sense and the magnanimity to say that this is not applicable now. So there are side effects of chemo, which we should tell the patient anyway. Then I come to another way of telling it that you can see in the square lymphoma patient, the result prediction, the professional competitiveness. And as you see in the red or the pink square or rectangle, by second day onwards, the lesion of the left axilla started to decrease. By second day, please note that. And by 7th day, the lymphoma mass disappeared. And you see the formula there, endoxan. There's something else being Christian, the chemo, this is mentioned there. Before that, there's another page. So can we claim that by putting Kotanchukadi or any kind of highly Tishna, Upavisha or Visha Dravyas, we can bring this impact in 2nd day to 7th day? Can the Lepanas create that impact? This is what the public would ask us. So this is how his axilla looks like after. So this is very important that we keep in mind. And then you have a situation that there's a hell of a pain in multiple myeloma. And then you see how 2 highlights have been made. And his chemo versions are very cost effective and OPD level. That's the word there. So he always looks for friendship from the allopathic community. That if some allopathy doctors can use his methods, which is very cheap in cost and very effective also, then the bridge is complete. No, that's very important. So as you will see, the red pen directing towards a pointed, the pain is more better after starting Canapane and Asafoetida. You see that. You see the better quality of life and how everything is happening there. And the chemo, he had come to avoid chemo and to avoid radiation therapy. Everything is very clearly written there. So here you see how the homeopathy, I know there are some homeopathy doctors who are attending it, how the homeopathy roles comes in. I have a clear agenda why I promote homeopathy. I'm Ayurveda doctor, agreed, but then homeopathy is our brother or sister, whichever you may call it that. So as is Siddha and Unani. So here comes the role of how we are getting into the integration. The 2 simple special things I mentioned, one is Canapane, the other is the homeo drop. So we come to another competitive efficiency here. Patient is CA breast, but bone metastasis. The patient has not even seen, in one case, Dr. Mathew sir, actually here, you see the Rasa Sindhura being mentioned, and you also see Rasa Sindhura is his very favorite. You will see that. And the patient, you will see in the blue enlarged, this one, that the patient is having near normal life in 2018, 30th of November, with a prescription of Ashwagandha, Purna Chandrodaya, Niroji Care. It's a mixture of Guluchi, Sat, and Siddhamarajaj actually. And everything is there. Now Pashana is everything mentioned. This patient has never ever met Dr. Mathew sir in person because of this skeletal metastasis, and sir said, you don't come to me. God forbid a fractured spine, done for life, paraplegia, whatever. So without even seeing the patient, he made the opinion that she needs radiation. On the right hand side, you see that after radiation therapy, the pain was cured, and for nearly 2 years and 4 months, she was without a pain. So can we claim that by our Kati Pichu or the entire spine Pichu or Svedana or Kiri, that this pain would find relief? That is the competitiveness we have to think about. When we know that there's a sure shot method using radiation as a therapy in metastasis which is gone to the spine, and the patient finds relief by the 5th day. So this we should know before we embark in our adventurism. That is very, very important. Unless we know this reality, the patient would not appreciate the fact of what we are doing. They may say, I can't afford 5,000 rupees per session of radiation. Doctor, try what you want to try. I'm okay with it. Then we have a clear cheat. Very important. So this is clear example how radiation helped the patient to have pain-free situation. And as I repeat for the 3rd time, the patient never met Dr. Mathew sir in person. It was the kid who was coming and reporting. At the same measure, you will see my duality now, time and again. Unnecessary chemo and radiation done to a child of 2-year-old age. Rhabdomyosarcoma, when Dr. Mathew sir himself tells, you see the big line there, whatever, it is useless to do chemo radiation rhabdomyosarcoma. This patient is now much better with his treatment, where he has integrated AYUSH and mostly aimed at immunity boosting. And here, can you imagine a 2-year-old child going through more than 33 radiations and chemo? I mean, adults can't afford it physically. What are we talking about, a 2-year-old child? So this is again an option where it is not to be done. So Dr. Mathew says that clarity. In this stage, you need chemo. Don't talk of AYUSH. Here, for goddamn sake, I use the word exactly, that is what he's using there. For goddamn sake, it's a foul language, I know, but don't kill the patient by unnecessary chemo. So that clarity he has, and that's what we also have to get into. It's a clear case of CA larynx, where the need of dysphagia is there, and he has very clearly mentioned that what is to be exactly done to that lesion. Radiation is the best thing to be done. So I'm just sharing without the name of the patient. It's just an example. And now we come to surgery, because when it comes to cancer, chemo, radiation, surgery, immunotherapy, these things are just playing around in the mind of the patient and where to make the right kind of understanding. So surgery is a must, in his opinion, in C endometrium. It's also very common, but he firmly opines that chemotherapy would harm. The allopaths won't agree, but that's okay. We leave it to their choice and interest. And this is just an example to show with the proof that how this lady of post-menopausal bleeding. Many ladies have bleeding after menopause. They just feel shy to tell it, unfortunately, and then it all goes up to a worse situation. A simple example where surgery is needed. There is no discounting that. And then he feels upset about unnecessary surgeries. And these photographs is taken without his consent and without his knowledge. He is not a photo person. So I just make sure that to get the right kind of impression to the doctors, I take this candid without flash. That's why the clarity of the photo is not much high. But this is exactly his impression. One example where oral cancer, avoid surgery is his, and then I put the word, big hospitals. The harsh reality of surgery, as you see in that, havoc caused by surgery in oral cancer, havoc. And he says that it is criminal offense if you do surgery in oral cancer. It's a criminal offense that he says. And we have even made a video on YouTube telling about that very clearly. But with more than 10,000 patients treated in these many years in his government service, he says that total dental extraction and radiation therapy is the best in his experience. So when I say this to an audience, when I convey this, I humbly accept the fact that there would be many, many Vaidyas in the Indian subcontinent who would have cured this without radiation, without chemo, without surgery. But I don't know the technology. I can only say what I have seen, what I have realized. I'm very sure that there will be plenty of Vaidyas who may have a solution that is alternative to radiation and what I have shared here. So kindly take it in that sense. I'm not questioning anyone. I'm just sharing. I'm a reporter. Here, when to avoid Ayurveda. Very clear fact, intrahepatic cholangiocarcinoma very much highlighted. But we better just get into that cholangiocarcinoma top, deep for vertebral body metastasis lesion with cord, and then you have paraplegia. It's an emergency neurosurgery that was needed, and that was done because a destructive lesion at T4 with cord compression. So again, I'm not offending any Ayurvedic or Ayush professional. Can the Ayush professionals claim with evidence, that's important, that such a paraplegia, I will do Pakshagata treatment and make the patient walk in the next 7 days' time? It may be possible, I don't deny that, but it's very unrealistic. So this is a competitiveness we have to know and the right decision. We have had situations where somebody got paralysis and the patient said that I like only Ayurveda. I went to a Vaidya. It went on for treatment for a month and two, and then you can't even do the surgery later, the decompression, the laminectomy, as you saw D3, D4. And it's very clearly mentioned, the cage implantation, everything is there. So this is where we have to be judicious and reasonable. When there is a surgeon who should be doing emergency neurosurgery, Dr. Mathew says, kindly don't hang around with Ayush. A surgeon should interfere. We can save a life. That's what he says, the apt approach. As I said to you before in the very beginning, so not said, as I shared with you before, we're looking for the right kind of strategy for the right kind of condition. This is what Dr. Mathew method is all about. But as we glorify surgery and radiation, this is what also happens many times, and Ayush has a big role to play in that. This is a WhatsApp screenshot between me and somebody with cancer, oral tongue, wherein the patient says that is in Malayalam. Radiation കഴിഞ്ഞ് എനിക്ക് തൊണ്ടയിൽ കുത്തിയുള്ള ചുമ മാറുന്നില്ല മരുന്ന് പറഞ്ഞു തരാമോ, which means after radiation I have dry cough, throat and this dry cough. Can you please convey message? So I wrote a simple word which is called Alsant syrup. It has a great amount of yashti madhu to it, and you see the screenshot on the right hand side. I said 10 ml. Vidam means itna each, 10 ml each, 5 times a day. And so he just verified with it. So I have wrote the name Dr. Sadevan sir, who guided me in this. It is his regular practice. And the next day, the very next day, the text comes choma koravunda, which means the cough is less. So we have a clear rule post chemo, post radiation, because we have to find a niche. So where to function, where not to function, very important to know. I mean, we live on the basis of hope. We live with hope. This has come in Manorama. So I have a word which I learned from my friends in north of India in Ayurveda. They say, "Jo dikta hai, wahi bikta hai." Whatever is visible is sellable or is going to be sold. So this is a newspaper in Kerala. I mean, it's very famous all over India. It's the most leading newspaper, perhaps in terms of readership. It's called Malayalam Manorama. Kerala people know it point blank. So the work we are doing, including our Telegram group that I am the admin and I'm helping doctors to get into, and more other things, they voluntarily, somebody from Manorama's father-in-law was with us, and so the gentleman was magnanimous enough to proactively report about this. So I thought it's important when you do something, you keep telling, so that others can also give you better inputs to make your work better. It's not about publicity only. Yes, जो करते हैं करना है, करेंगे, बोलेंगे भी. But then we would help others to help us better. We can make the movement better. So it's just that. So when you also do, you have to make like that. Cancer breast, very common. Surgery is the biggest mistake as per Dr. Mathew sir. Of course, there are cases which have failed in his approach. I humbly confess that without making a guru taked in my statement. But then in his majority of experiences, it is metastasis. So anyway, I'm not debating on it. I'm just conveying whatever it is. Here, in this lady's case, lumpectomy was done and she came at the right time. Lumpectomy was done. Chemo was advised. She was not keen about chemo. Dr. Mathew sir said, when you have lumpectomy already done, don't go for chemo and don't make it complicated. Don't lose your health. So this is the kind of strategy that, and all these screenshots, some of you would have already seen in my group already. Again, you see the promising results of AYUSH. Like in 7 days time, the patient who already went 3 different hospitals, devastated mentally, physically, financially, 13 chemo, 15 radiation, no improvement. She comes to us and you see the, it's written in Malayalam, but you know what to do, but it's like Nair, Vedana, Amba, Shaman, 50% relief for pain and swelling, and later on 75% relief. I mean, they find a hope. When nothing helped, with so much of least cost medications, they find a hope. And tomorrow is a different day, but let us have hope at least. So this can be such a great impact of AYUSH. Now again, when to avoid AYUSH? Respected doctors, kindly don't think I am playing double standards. I'm being very honest with my experience that I've had firsthand. So I'm telling you where in this case, somebody with severe breathlessness, already on chemotherapy or something else, whichever, comes to our OPD. And of course, we will scan anyone head to toe through our eyes anyway. The patient may not say, but we see the nasal alley desperately going out in, out in. And then we send for X-ray because that is 250 rupees only. Why to go for CT or costly 6,000, 7,000 rupees? Simple X-ray, plain PAVU chest, and you end up seeing pleural effusion. With utmost respect to the Vaidyas of Indian subcontinent before us and those who are already now, can we bring the impact of the relief a pleural tapping makes? The patient says, as soon as the needle is out, I found a relief. Next 5 to 7 minutes time. The patient says, in 45 minutes time, I am out of breathlessness. Can our medications, even if it is RASAAYANAM, and again, with utmost respect to all of their enthusiasm, can it create that competitive impact? So having the X-ray helps, obviously, in a breathlessness, which may not be always tempted to do it, and the pleural tapping, very important. So this is the way we have to think about. Same time, somebody with jaundice, I understand we have obstructive, we have hemolytic, whichever. We have the Ruddhapada, Kamala, agreed, all said and done good. We know Trikadu with Bija Puragarasam, Lihyat, Vyosham, all good, fantastic. But can we bring down bilirubin 7.1 to 3.5 in the very next day? Agreed, it is costing 2,80,000. I understand that. I agreed there are more than 30 medicines being consumed. I understand that. But then, can we bring that jaundice that quickly down without surgery is not exactly stenting, but kind of it's a manipulation method anyway. This is what we have to be keeping in mind, because in cancer treatment, whatever little I know so far, I have realized it's a war on, battle after battle, challenge after challenge, the right kind of decision. They bank on your words, they rely on advice, and you don't want them to blamed by them, and you don't want them to realize that you're not aware of the strength of the allopathic system, etc. So there we realized stenting was necessary, and it's necessary, and we bring down the bilirubin very fast because the things are tangible. And mind you, there's a big anti-AYUSH lobby against us, big anti-AYUSH lobby. So we can't go wrong at any point. This is a common mistake. Many people with breast cancer, metastasis, many doctors, many big hospitals ignore recommending Taylor's brace. This is Dr. Mathew sir's experience. Whenever somebody is skeletal metastasis, more so spinal, Dr. Mathew sir says, if you come to my OPD, don't be upright, lie down in the car or whichever vehicle you are coming, because most come in the private vehicle, obviously, and then only come to me. You never know when you get fractured. This is one advice missed by many people. Dear doctors, I don't want to sound foul-mouthing, but there are two ways of being good. One is to be good and do good, and second is to make others look bad. I'm not doing the second variety. I'm just conveying what Dr. Mathew sir has lamented in the OPD a number of times. And again, in thyroid cancer, you see the dependency on iodine therapy. Agreed, the medullary variety is hell. Agreed, the papillary variety of thyroid is, thanks God, better. Agreed. But then, can we deny the iodine therapy in thyroid cancer? So the answer is a matter of debate. Again, Dr. Mathew sir did not know that I had shot him point blank without his knowledge or consent. Psychology is very important. Unfortunately, it is not much available. There's a clear need of oncopsychology, and that is one area where AYUSH doctors can definitely contribute a lot. If we create an ecosystem, anyway, when somebody is in cancer, it's a long battle, most likely. The multiple stakeholders, everyone has a role. So I think our professionals, our graduates can get into that if they're not willing to get into the organic part of anti-cancer management. So there's always scope because Ayurvedic people are very good at listening to people and being empathetic. So this is one area we have a scope. Of course, the interest has to be there. And here you see a simple approach of the integrated method. Aloe vera is a must. Chemo is needed to shrink the mass. Sometimes that's not enough. The bleeding still happens. You need radiation, and AYUSH is of course needed. This is a case of bleeding per rectum. Somebody dragged and dragged and dragged till he realized later that it was C rectum. So with the rectal growth. So many a times these rectal growths are like thought of piles and hemorrhoids, etc. They really get a delayed diagnosis, unfortunately. Again, this was shared before a simple prescription. I think I don't repeat it. I just go there. And you see by the 10th of December how now nil bleeding per rectum. It's in 1 month's time. So this is a competitive feedback we have to keep. The methotrexate fluorouracil combination helped that bleeding to come down because the mass was shrunk. That is what happened. And you see very clearly now toilet visit 5 times compared to 12 times a day. So it's all, this is the way we have to make it happen. And then they even say the mucousy stools, sticky is 50% relief. So when you quantify your results, the patient gets more confidence. You just can't say you'll find relief. You have to say this symptoms relief in this much time, in this much of percentage. And here, the role of radiation, I'm coming to that again. What can you do when it's a hell of a pain? The lesion is very large. The patient cannot afford chemotherapy and chemo doesn't suit the person. Not only financially not feasible, but also body-wise not feasible. So this is just showing an example how he would write to a radiotherapist requesting, can you please do it for this person? I think this is what has to be done. That's why I shared the letter as it is to convey and impress and prove that this is his approach. Pain relief. Again, Sudarshana Churna or tablet which are coming again. It's a case of the sarcoma retroperitoneal, and these patients come as symptoms as vague as abdomen pain and diarrhea. We can't rely just Kadiyadi Kashayam is great, Ashtachurna is great, Hingujad is great, I don't deny that, but unless you have a tangible so-called evidence-based or so-called modern diagnosis, the patient can later blame you. You did not detect my cancer. So anyway, this case, the pain was so severe for the patient, such hell it was. After Hinkuvajadi and this, it went on so good and better. And then you see it's very clear cut. This screenshot is self-explanatory. I'll rush through that. And one tablet had thrice a day only. I'm very grateful to Dr. Sadev and said, painkiller, this is his method. Why I'm focusing to the pain aspect, anyway, we are not going to cure cancer. We all know that invariably. I think hardly 10% of the people get cured. That's the impression I get from allopathy doctors. So at least let us give a decent farewell. Let us give a pain relief. That is still a bigger deal. And with medicines which are commonly available and which are not harmful by any means. I just bring some non-medical social things as a screenshot in between so that you don't get saturated with medical information only. The names are very clear. We'll come to these names sooner and sooner. Vasan Kumar sir, I already mentioned. Dr. Vinu Krishnan sir, homeopathy. I'm coming there. Thank you, because you see the word which is very important for me. A broken system, a roadmap to hope. This is what a cancer patient feels. And we must thank all those doctors for their service. Dr. Vinu Krishnan, I have met him only once. His phone number is and he's in Vandoor, which is Kerala, Malappuram district. There's a homeopathic doctor. It's a government doctor like me. I met him, and you see the prescription. It's a cell lung, metastasis to brain skeletal scapula. Navapashanam thrice a day, Rasasinduram thrice a day. With Tulsi Neer is Tulsi Neer, Purna Chandrodaya 111. This patient, I had to do a deal exclusively because Dr. Mathew sir was not well. For 2-3 months, he was out of action. For some reasons, he was multiple times admitted to intensive care. Some things, anyway, he could not be on duty. So you can see the pain relief happening after 2 days. And it became bearable by 3rd day. I don't know which acted. Purna Chandra Ras, nobody is typically using as painkiller. Rasasindura has not been formally recognized as a painkiller, and neither is Navapashanam. So I would humbly attribute, my knowledge in Ayurveda is very less. I confess that. I have my limits. I don't have any problem accepting that. But I don't know of many doctors in Ayurveda who would claim that Navapashana from Siddha, Rasasindura from Ayurveda, Purna Chandrodaya Ayurveda Siddha, like would say that we'll bring the pain down after 2 days by this. I do not know anyone. It's my lack of knowledge, most likely. So I would believe the pain relief was with these homeo drops, and for 1 month, it is costing only 250 rupees. Should not we recognize that, and not to recognize that, accept it and propagate it. That's why a part of my heart and soul is with Siddha and homeopathy also. And you see the relief as simple as so. Salutes to the homeopathic doctors who created it. This is of no use to Ayurvedic people, I know, neither for Siddha people. If somebody is in homeo group here, I'll just rush through this. I'm not staying much with it. You will have the PowerPoint from the institution anyway, so very specific. Because what happened is, I had a very special situation of Chakravyu. Those who know Mahabharata, they relate to it, but those who don't know Mahabharata, I'll come to Chakravyu. I had a special surprise test. I'll come to that. So canap pain was not getting available. Very tough. And pain killing was a big challenge. I went to Dr. Vinukrishnan sir in homeopathy Vandoor to his home. I said, sir, kindly help me. I know homeopathy has great medicines. Kindly help me. He gave me the list. And the list I am sharing, I have shared it in WhatsApp groups, the same thing. Because if nothing else, cheap in cost, effective, why not have it? And I'm just, it's Ayurvedic people don't need it, I know, but it is very, very useful. It is his proven method. It is his regular prescription. And here you see the use of Rasasinduram. This is the diary of 1984-1985 segment. And you can see very clearly the good pain relief, and only with Rasasinduram is there. And then you see Chandamara Sinduram is also there. You see the cost of this prescription, how cheap is the cost? I mean, the cost, how great it is. And see a prostate. And the diary is self-explanatory. I don't have to say anything else. And it's a mercury compound, obviously. Kind attention. I don't have an agency of Siddheshwara. I'm nowhere related to them. I know Dr. Shashikumar Nachiyal sir. He's a great, great person. He's a champion in the field of Rasashastra. We are proud that he is with us in our Ayurvedic fraternity. But Dr. Mathew sir has enormous trust on the medicines of Siddheshwara. Again, this is no marketing for Siddheshwara. Let me be very point blank about it. So he always tells me, Dr. Mathew tells me, Sreejit, Rasasundaram is a must in my prescription. His prescription. So I thought, let me represent somebody who does it authentically, as does Sitaram in their a secret or a covert operation somewhere in 1991. Regional cancer Rasasinduram without the knowledge or permission. Covert point. Still has power in spite of being 92. So this patient was such a great impact. That screenshot of his diary. The allopathy doctors, this is very clear, nothing to explain. The WBC doesn't go for a toss and go and the platelets also. Very impressed that the quality of life of the patient was much better contrary to their experience and expectation. And that is because the Rasasundara was being had, and this is the impact it makes and so easily available. Just an example, sometimes we have to do these kind of things and we still do it. So this is a clear example how many of us in our college days may have inhibition towards Rasa drugs and Rasa medications. As you see a breast with skeletal metastasis very clearly there. For 8 months, it is being used non-stop. I know many of us would not agree. Dr. Mathew says, look, anyway, death is staring. It's skeletal metastasis. I would prefer to have a challenge of renal, than let the patient die in horror or bad health. So he took the risk, and you see very clear cut, everything highlighted, normal LFT, RFT, good quality of life. And just to prove a point that the lady was having Rasa Sindhura for a long time. One important thing that I put in a box, violet box. This is cancer breast patient with such a hell, and she was paralyzed, and no radiation was done, and whatever was to make her better. The husband says everyone in the family got COVID except her. A clear indication the impact Ayush made in her, even though she was the most immune compromised. That is why she had cancer. So it's a clear indication how our medications, they have such collateral benefits also. And can you believe, when everyone in the family had COVID, only she was spared? That itself is a proof how best our medications make the impact in the body. This is something different to change your mind. Dr. Mathew sir is very vocal and very authoritative and very assertive. When he finds medical cruelty happening, he writes to whatever levels he can write, at least to bring his thoughts very upfrontly. There's a lot to learn from him in terms of being assertive. To say you think is correct has to be told. So this is a case where a patient was denied Burkitt's lymphoma, was denied radiation therapy when it has to be actually done. So that is his way of telling things. Competitive efficacy, helplessness, tired, legs edematous, and we understand it's a kind of Pandu-like scenario. And if we do the blood test, we know it's less than 6 or nearly 6 gram percentage. Will it be ethically correct and medically feasible to give Mandura Vadagam at that point, which is a great medicine, we know that, or even Drakshadi Kashaya for that matter, when we know if the HB is less than 6, this I did not learn in my UG days or my PG days. I learned only after I was associated or am associated with Dr. Mathew sir. The lesson he conveys is that Ayush is great, but the platelets is less than 20,000. For God's sake, make blood transfusion happen. And for God's sake, HB less than 6, you can't keep on using Ayush. You need blood transfusion. So we should be aware of that. A tricky history. Again, somebody had only symptom of abdomen pain, ended up in AML as diagnosis because just by accidental finding, low HB found, low platelet found, high WBC found. So why I'm telling these scenarios to youngsters, so I'm not telling this for those who are senior to me by age and experience, but youngsters who are watching this 20s, early 30s, at least slide is for them, that you need to keep such huge, broad spectrum experience in your mind. And smart to go for at least minimum blood investigation for almost any condition that you come across, because in this patient only abdomen pain not resolving, and then you have this reality AML. Proving that experience with a simple screenshot, very clear cut, you see the HB was 5.3. Now who on earth would relate an abdomen pain to this kind of blood picture? And when the patient came, already the gentleman was on palliative chemotherapy, supportive care, etc. My point to convey here was that platelet 28,000, WBC 53, 100, HB 5.3. This was my point to convey, that modern medicine diagnostic technique has to be taken in a heavy manner to make sure that you are on the safe side. You start with whatever medications, the Hinguvajati, Gandharvastadi, Abhyarishta, whatever for abdomen pain, and you end up after 1 month finding the diagnosis. Why did you not do even a simple blood test? I am very surprised, doctor. here is what can I do? This is a point blank prescription. You see the Ashwagandha, Rasasindura, Giloi. Madhuvarka is actually arsenic.
Sir, your
Purachandra,
slide is not
tablets,
visible.
that's
Can you present your slides?
now. No?
No,
Should I
Please share screen, doctor.
share again? I think let me do that. Is it now?
Yeah.
Yes.
Right.
PPT mode, please.
Yeah. Here you get this the prescription very clear cut. Ashwagandha, Rasasindur, all very clear cut. Giloi, everything clear cut. So I think we'll exclude that. Mathew sir always says, Sreejit, in cancer, Ashwagandha is a must in cancer prescription, anti-cancer prescription. And that is so easy. And he has a share of experience to say that. I have not seen him writing Ashwagandha in only the 2,600 plus patients I have seen in front of him directly. I think hardly 7 or 8 people did not get Ashwagandha. They were melanoma and some situations like that. Not even 10, no double digit for sure. So that is important to give Ashwagandha. I mean, this is one of the best brands. I use it personally on me and I found it great. I am sure there are others who have it, no doubts on that. This is one of the best I have found on myself, but I'm sure there are many opinions. And this is it's an extract actually. It's an extract they have. And you see the impact. The HP went to 9.9 and you saw the chronology also. The date was there before mentioned. 1 second. April 20th, the patient came. And by May, something that was 6.7 is like 9. Of course, the diagnosis is still elusive. But on 24/6, all symptoms of day 1 have disappeared. But itching remains, vaginal itching actually, nothing to do with cancer per se. And here, my point to communicate to you was the documentation. You see the June 4, June 15, June 26, you see the smileys, everything there. And 10 drops of arsenic was used. We use the word Madhuvarkam, but it's arsenic, simple as that. It's easily available. And even maybe arsenic album helps in that case, but that's not what has been used. It's Madhuvarkam. It's easily available in something called Southern India Pharmaceuticals, Cheruduthi Road, Thrissur. It's 1% arsenic. It's British pharmacopoeia. So everything shared here now with you. So here, the blood transfusion is humbled by AYUSH. So we are not trying to humble anyone. We're just trying to share what is realistically happened. So very, very important. We have been talking of dawa, which dawa is all our friends know it is medicine. Now let us talk about dua. You call it prayer, you call it mantra. Every day, I make it a point to chant this for our cancer patients. This is, I could have taken a screenshot from Sushma Samhita, the original Sanskrit Devanagari Lipi. This is written by a former Miss World, a dear friend of mine, a lovely lady of very high caliber and high substance and quality. She has by-hearted it and she recites every day. I do not know how many Ayurvedic doctors have taken the pain to by-heart it. And she's from Bollywood XYZ, whatever. I mean, I'm telling you that the public is very enthusiastic of our methods. And that is why I wanted to prove a point. And this, what I'm telling you, is not for seniors of mine. It's for juniors who are 20s and 30s. This message only for them, not for seniors. I'm not qualified to say anything for seniors, not at all. And when you do this, I have spoken a lot of heavy things medical wise. So I want to make it a bit lighter. So a few slides would be a bit lighter, kind of. Eternally grateful to patients like this. The fear in their eyes, the trauma they go through, the trust they give us, and we fight a war, we know that we will lose for sure invariably. And this is a very soul formatting experience. I can tell from my experience. There are many moments I would just go weak in my soul and we become weak knees very, very commonly. It is why I say this to you here. When you treat cancer patients, my knowledge is very limited, that I confess. You will have to protect your emotions. It's not the cancer patient only suffering. We also suffer because we involve. We should know, we should be sensitive enough to feel the pain. then we get the best out of our profession and our service. But we should be mature enough to detach. The policy of attached detachment or detached attachment, whatever way you may think the Buddhist way. It's not easy, but I think by some time it should be possible. We also get affected dealing with patients. It's very intense. This was before he got into the ICU. Dr. Mathew sir did self-harming habit. I would use the word self-harming habit. In spite of the insulin-dependent diabetes and a situation of 400, sometimes 350, sometimes 450 blood sugars fluctuating, in spite of the eyesight deteriorating due to macular degeneration, in spite of the so many difficult health issues, he ignored his health for the sake of patients. And I think that's a bad example. I am not supporting him for this. He is an example to us that we should not harm ourselves as he harmed himself for the sake of patients. Working 6 hours a day for 6 days a week at the age of 91, 92 with an abscess in your leg and if blood level fluctuating. And can you imagine what the patients feel when he himself is on a drip in the OPD? He did not know that I took this photo without his consent or without his knowledge. Till 22 March, I used the word 22 March. Incidentally, that was a day he was honored the Lifetime Achievement Award on 21st, 22nd, he was awarded that. And then he had to be admitted to ICU, whatever. And then happened my small story of nearly 3 months. At those moments, when you deal with cancer, I know it's not very medical what I'm talking now, but cancer is not just about diagnosis, prescription, treatment, the strategy. There's other part of it, and I strongly believe in that. When you show the real interest to study, the teacher will appear. And I really thought, God damn, I'm done. A situation when I realized he's ICU, his life was in threat. There were 3-4 incidents happened. He said, Sri, you are in the Chakravyuh, you deal my patients. I am perhaps no more anymore. And that was a difficult situation for all of us. And as Nimitta would have it, somebody, I think it's Dr. Jobin John, who is a medical superintendent of Sitaram Institution. I think most likely he had put a message in the WhatsApp group of another friend of mine, Dr. Joman Joseph Daniel Coffee Corner. He put this message. I said, God, is it what I'm getting a message? When the student is truly ready, I was confident about what I was trained, the teacher will disappear. And I hope that is not my version. So we have to keep this in the back of mind. I should not forget the role done by Madam Jasmine Shibble. You have a phone number if somebody wants to contact her. And she's the assistant for 4 years. She's not a doctor, but this is one photo. Dr. Mathew sir was told we are shooting it. All photos are shot without his consent and knowledge. So we both are his kids or assistants. And her experience, it's important that faculties who know a lot about cancer and the follow-up is 4 years. That's quite intense knowledge she has, very thorough, his methods. I think, yes, talking about Chakravyuh, I spoke before. All of us know it's very difficult situation. Dr. Mathew sir happened to give me his OPD for nearly 3 months. And I was looking up in the sky when he said to me, Sreejit, Sreejit, whatever you do or not, the cancer patient, for any cancer patient, Rasasinduram, Ashwagandham, Purna Chandrodayam, you should write it. I said, thank you. But that was very difficult for me because when somebody is 91 and somebody is 41, 42, whichever my age, but there's a gap of 50 years separating us and what more not. And I don't sit in his chair, of course, never. I never did that, but I took a side chair, consulting. It's a very tough situation, the expectation, the reality and everything. I was just like looking up the sky. I told myself I have been trained heavily, intensively, I'm confident, but there are many situations I have no answer. And there you need a guru. That's the situation. I sent it to my colleague. I said, buddy, this is what I've been told. I feel like I'm in an Abhimanyu situation where I don't know how much I will do good. She just said to me, doctor, maybe Dr. Mathew sir wants you to be Arjuna and not be martyred like Abhimanyu. That gave me a lot of courage and a lot of consolation and solace because Those are very difficult situations to take up that, and it was a surprise test. And I just kept that in my mind. And I'm sure many of you who will get into this will face similar situation in your life, where you may end up being a Abhimanyu in a Chakravyuh. But if you are like being rock for your patients, like rock solid, you will have opinions and advices coming and helping you. That's my experience. Canapain is very clear. It's used for pain-killing effect. And we're coming to pain-killing now. The anti-cancerous effect of canapain is the cannabis is there, and you have these medications available in the market. But the side effects of hallucination and blackout is very, very high possibility. So when you give to a patient, you have the moral and the technical responsibility to communicate that yes, these things can happen. Otherwise, it's very, very difficult situation. They're already confused. I'm coming to those medications. All of us know SKM Pharmacy. Again, I'm not having an agency of them. I'm just putting a screenshot. They are doing great by serving these kind of medications. You see it's very clear cut. It's all very clear. Navapashanam, the cost is only, I don't know if it's Navapashanam or some claim is Panchapashanam. Whatever it is in the market, it is available as Navapashanam. You can see that 180 rupees for 2 bottles for 2 months. Imagine the like 200 rupees for 2 months. It's like hardly 3 rupees and a bit more. And the impact you can see clear cut. I'm just telling you how cost effective it can be. And this was a case that was the patient had not even come to Mathew, sir. The patient is in UK. Actually, it was very interesting for me to note the changes that happened to the patient just by Navapashanam, 1 OD. Does the impact it makes in the system actually. So cost effective, so easily available. And I'm putting the example of very good quality of life. Somebody who was told for chemotherapy, chronic lymphocytic leukemia, 75 years old gentleman, good quality of life. He used Siddha Magradaja for 1 year. He used of Siddheshwara drugs. And you see the dosage, whatever was used, very clear. Ashwagandha Churna and those medicines very clear. The third one is Shiva Gulika, is in Malayalam written. Other things are very clear cut. The 8th one is Rasa Sindura, 1 year, and the 9th one is Siddha Magradaja. And consuming is 1 year, LFT normal, RFT normal, everything fine, and good quality of life. So why suffer with chemotherapy when this can be an option sometimes? And just a change of subject, the healing touch, so important, so important, so important. Say, this is again an example where CA prostate, PSA is keeping on increasing, so make a decision about what has to be done. The PSA is increasing, you need the chemo at a certain point. Sometimes you need the hormone therapy, sometimes you need the radiation. The letter for radiation was given because the PSA was not coming down, the pain was much. So this is the kind of clarity we need in advice that we need to give to any patient. And this is a case I mentioned before, in spite of avoiding chemotherapy. Please note, in spite of, like, he could not do chemotherapy only because he was prepared for the chemotherapy by giving a lot of steroids in his body, and this lot of steroids made a situation of what can be called as a hyperglycemia scenario, diabetes induced by steroids. And then he said, come on, I came with cancer, I go back with extra diabetic mellitus, I'm not coming for allopathy, I'm done. He said, I'm going to die. Then he came to Dr. Mathew, sir, and the Ayush protocol, the medicine list I already shared here. This is the medicine list. And then, he's doing well even now. We don't know what will happen tomorrow, but this is an example. So this is how we find our scope easily. And then there are situations, post-chemo, post-RT, post-surgery, all messed up. In spite of even brachytherapy, that is localized application of radiotherapy. So it's C endometrium. So this can also happen in reality. And I thought, even if you're not intending, if you are somebody 25, 26, young doctor, you don't plan to get into oncology big way, at least if you can say, okay, Ashwagandha kadikya, Nellikkai kadikya, aloe vera kadikya, juice akka, you're doing some good to the person. None of them would upset the AMA factor or Agni factor, etc. Aloe vera may slightly, but no. So this is what we can at least do to a patient at a domestic level. Brahma Rasayana, Amala Cancer Center has the study, nothing new. Because just as I mentioned, a screenshot of post-surgery, post-CT, post-RT bad shape, I am accountable and responsible to say that Dr. Rajagopalan sir, Padma Shri, mentor of many of us, I was with him for the last 3 years of his life, of his professional career. I was in his Sunday OPD every Sunday. He was always telling me, Pradichamadi, Ayusham in the Ayusham Falasruti is only for Agastya Rasayana and Brahma Rasayana. Maybe the Haritaki is the major reason for it. So we all know that a faster recovery after chemo and after radiation, as the study happened in Amla Cancer Center many years ago, I think nearly 20 years ago, this is a fantastic thing. If the oil is not much, we have to be very careful. In the market, a lot of things are highly oily in these areas. So why I'm using this part here, if a doctor doesn't want to involve into active cancer therapy, at least he wants to deal with post-chemo, post-radiation, and a patient is asking for prescription, chalo, at least you keep the Agni intact by Vaishwanara or whichever, Ashtamgam, whichever you want to be. And you make sure that at least Brahmarasana is given. It is doing some good. You're getting Ayush to home. Ghar ghar mein Ayurveda, this is what I would aim for. Or ghar ghar mein Ayush, this is what I would aim for. So that we do some good than nothing at all. And here comes, now we have been speaking all medical. I would like to get into non-medical. Now, how do you justify already has 3 cancers in his life? You first have the renal cell carcinoma, then the surgery done for it, and then what kind of challenges? Then you have the GE junction challenge mentioned there very clearly. Then you have the hepatocellular carcinoma. I mean, what's that? How cruel can God be? And here in this patient, CMC Velour had done chemotherapy, but heavy, the body heavy. So you can't do surgery, you can't do radiation, technically not feasible. Chemo can be done, the body is not favoring you because there is heavy reaction from the CMC Velour chemotherapy. What can you do? This is a very catchy situation. 3 cancers for one patient in one life. The non-medical method with medical impact. Respected doctors, when we speak about mantras in our democratic setup, when we talk about procedures which are Deva Vipassana Chikitsa, there is a tendency of the secular brigade to say that it is certain religion, certain ideology, certain organization, and unfortunately certain political party. So let us be very frank about it. This is medical talk and we intend medical intention. And Dr. C.P. Mathew, your name itself is very clear which background he comes from, religious wise. So we are not getting into religion thing. There may not be very much takers of this point, but I'm very point blank what I mean because that is my experience with him. He strongly recommends in such situations of obscurity and ambiguity about the reason and whatever, Deva Vipassana Chikitsa. He strongly mentions, I don't know how much a modern medicine doctor would accept it, but then that's how it is. What I'm communicating is not my word only, it is your own great grandfather of the profession. Astrology, mantra, yantra, he highly advises. And in the Pathya, part 1, 2, 3, the WhatsApp I sent, I have mentioned that. But we don't say explicitly to the patient because not everyone would take it in the right spirit. But we put in WhatsApp. And those who have frequency aligned, they will go. They will go to Dargah, they will go to a church, they will go to a temple, they will go to Jyotish, they will go to Gurudwara and get those things sorted out. It's their responsibility, not ours. We can only hint once or twice. So, yeah, at the age of 61, he started Agnihotra. I have a point to tell why. And we started cheating him, and also his health started deteriorating. Charyan Ashram started doing for cancer patients. Anyway, he started more than 30 years ago. Charyan Ashram started doing it in the institution for the welfare of patients. It has a great impact. And I started doing it also after being associated with him every day for cancer patients. And it has a great support to the emotion and soul. It gives great strength because we get extremely upset many a times seeing the suffering when we are also helpless as much as they are. So I would use the word appeasing the forces. Dr. Mathew sir time and again tells in kids 4 years, 5 years, what wrong Nidana did they do? What wrong did they do? They did nothing wrong. So I'm putting that past life sin, Purva Janma Kridam Padam Pabam, whatever you may call it. He strongly recommends in non-responding and unexplainable cases of cancer, he strongly recommends Deva Vipassana Chikitsa. And Agnihotra is something anyone can do it. Ladies and gentlemen, respected doctors, seniors or juniors, kindly don't take it as a preaching of any ideology or any religion or any organization or any political party. I know very well, many people have trouble when I keep the flag on my chest. They think I belong to a certain party. So I want to be very clear about it. It's totally Ayurvedic narration. Appeasing the forces. I have de-escalated from a hardcore medical narration to something lighter. So that's why I'm just deviating your psych. We are already overdue our time. These kind of images you find when you do Agnihotra. I'll come to a very great legend, a living legend, Dr. Tapan Vaidya sir, a bit later. I don't say it's a dinosaur. You can take something else of it. Divyajyoti, as Dr. Tapan Vaidya sir told me later, looks like a man, whatever. I don't say it's a holy cow, but it's very interesting things that happen. This is Sushruta Samhita, and it's a kind of image that comes. It's very interesting. So if you think you can get a chance to treat cancer patients, it's a big no. If we have all the information now, we have all the technology, we have all the experience, we have all the backup plan, everything is there. But if you think you can treat, the answer is a big no. If, what exactly, I will tell. This gentleman, I would have no hesitation to say whether he's on a payroll of any, I don't want to say more, you can guess. It's my speculation. How can somebody say Ayurveda harms when there is Ayush ministry there? But thankfully, you see, they have got 7779 views with 1,200 dislikes. This was done in June 21. So I thought, we are not sparing anyone who is going to offend Ayush. So we did a counter campaign, and our campaign was disliked by only 9 people, 09, not even 2 digits. And their campaign was disliked by 1,200 people. So truth always is seen by public. On top, you see Ayurveda can harm you, YouTube video. And as my limited capacity, I've done this. I'm telling this to you because unless we have the niche and the ecosystem and the market, if I use that word politely, I don't mean market per se, opportunity, all your knowledge आपके साथ ही रहेगा, आप उसको कभी use नहीं कर पाओगे. That's a reality. So we have to create opportunity for youngsters alike. So anyway, this gentleman, so what he did, we did our counteract. I just made a joker of his face. I think he deserves that for defaming Ayush, and not only defaming Ayush but also defaming the ancestors of Ayurveda and our future generations. We don't spare that. So anyway, at that point, 7 dislikes, 2 more disliked my this, and in a span of we reached nearly, with a difference about 40-50 views. Our video came 3 weeks later. His video came. I was waiting and waiting what other nonsense he creates. So I bought everything, give one shot, one bang. And then just a matter of 40-50 views lesser than them, but 3 weeks later. So I think it's very important that we respond. We get to some role models. This is not medical, but you can take a screenshot if you wish. These are the kind of doctors Dr. Mathew sir highly values. So I've shared the contact details. This is a very fantastic kid, because she's a young child, 25 years old. Dr. Nihal Suhana from Shantari College, very fantastic, very, very academically serious. She has typed the highest number of cases of Dr. Mathew sir. She's helping me. One Dr. Atira, and she's now a MS first year, Alvas College. I call her Atira the sincere, the other I call Bold Nihal. Very, very sincere, hyper sincere professionals. They typed the maximum number of cases of Dr. Mathew sir. Thankful to them. Dr. Tapan Vaidya sir. I volunteered to be his room service boy when he came for Ayurcan AMI function. And this is, excuse me, Dr. Vignesh, I will connect the battery. The battery is getting low so that we don't get off. So it will happen. If there's somebody coming the screen, kindly excuse.
Sure, no issues.
So Dr. Tapan Vaidya sir, both phone numbers are there. Actually, he is our role model from north of India, just as Dr. Sahadevan sir is from South India. So anyway, I think one day he may also grace us through this webinar. I'm just connecting the community with stalwarts of our thing, of our community. I was very happy to be his room service boy, if you may call so, to license, because he was alone. So when he was in Thrissur, so great personality. All about him. He has these many patients already documented. I put in Reading, and is there. I don't have to say, everything is on the screen. By the way, I put the black glass because it was after a Kuti Pravishika kind of scenario, so it was not for fun. I was in black glass after that. So anyway, we also have to not forget the fact that we have to defend ourselves. We have to be assertive in a magnanimous and assertive manner, because the anti-AYUSH lobby, can you imagine Kerala? I don't know how much your friends outside Kerala know. This Dr. Philip, the allegation made Ashtamgam damages your liver, Haldi damages liver, kidney is gone by Amalaki. So when you have such kind of enemies around you, we need doctors like Dr. Biju sir. He is a recipient of Best Doctor Award of Homeopathy. He is a warrior, and many Ayurvedic organizations and doctors can learn from him. He defends AYUSH like tooth and nail, and he has humbled many malicious intended, arrogant allopathy doctors who defame AYUSH. So we can always learn people from like that. And we did something similar. We made a AYUSH defense squad. I just volunteered for that. The message was sent to nearly 2,200 doctors to counterattack whatever was done against us, because unless you create opportunity and protect the public psyche from getting poisoned about AYUSH from the anti-AYUSH lobby, you don't have an opportunity. And then what we do then? Interesting 5.5% of the doctors out of 2,200 thought it was necessary to join a defense against whatever is done against us. But anyway, I'm very grateful for that. Let us think how much water is filled in a glass, then how much is not filled. So we are doing our best. If somebody ever wants to join us, they're more than welcome. If you want to defend the legacy of your ancestors, and if you want to protect your future in the online platform, I have a simple word. Koi bhi AYUSH ke khilaf bolega, online mein thokenge. That's my language, however foul it is. Online mein thokenge unko. That is the intention. We can't do in person anyway. And this is something that you may be finding useful. Mission Revival. There is a YouTube that was made way back in the month of May 2020. And it's all there. Whatever things I could not convey here, those episodes, all those episodes, 32 videos, tell everything Dr. Mathew sir has to convey to us. So Dr. Anjana Rani Nair, she is a big help for us. There's upcoming couple of books of Dr. Mathew sir in this approach. Many things I can't convey in this small frame of time. Dr. Anjana is a very, very sincere lady, very sincere doctor from Ayurveda College Trivandrum, a lot of experience. She's helping us. It's very important that if somebody wants to get in touch with her, all her credentials here. This Mission Revival, if you just simply Google Mission Revival, Dr. CP Mathew videos, everything is at your disposal. And if somebody wants to learn these methods from Dr. Mathew sir's, I keep adding doctors. There are many I haven't added for the last 10 days. I was waiting for this program to get over and add everyone one shot and take along people if they're coming. If you're keen about learning 6 lessons, we have already informed these many people, about 200. 140 is an old screenshot. We have now 220 people already in it. This group helps to know real time from the OPD, live from the OPD most of the time, not always. So it's like wherever you are, you have it in your Telegram group. Very important for all those who are 20s and 30s. In your life of professional, there's nothing to do with our medical side. There's a heavy cost I have paid for what I am conveying in front of you now. It's not just about the family time, which is irreplaceable and non-refundable. Huge amount of time and effort. To the extent my son even sometimes asks me, who is more important, your cancer patients or me? So that's a bit of shame, that's a slap on your face. I accept that, I acknowledge that. It also was my government service. I left the seniority and the salary of my government service to make sure that the legacy is not lost. And for me, it's a clear 18 to 20 lakh rupees gone from my service. But then lessons I have learned is crores. The lessons we are able to share is more than crores. It's priceless. I won't put it like crores. At a time when our institution, NABH hospital, like most of the Ayurvedic hospitals, it also got hit by the corona because majority of people were coming from outside Kerala and such. For all that, I think I must at least show the courtesy and the decency and the magnanimity to thank my wife, Dr. Jayalakshmi, for allowing me to be in this in spite of whatever cost was involved. As Dr. Vignesh has said before, I am still an intern. I stand in the OPD. I don't sit in the chair even. My seniority in the government service, my everything, it doesn't matter. I'm a student yet and I'm still the same. My most important point here to convey was not about my cost. It was about the life-work balance that is so much needed. Because I know there are interns from 19 Ayurvedic colleges listening to it. I know a good majority of them are 25 plus, 20s and early 30s. We need to work on ourselves for the life-work balance. If it doesn't happen, you're doomed. You'll be kicked out of your home. In my case, I'm lucky, so far not out of the home. But that might be reality with everyone. I think last thing, every human being who makes and will make the world a better place, let us dedicate to every noble soul, everyone. And if anything, I can be of help to you. These are a couple of my emails. I have the notorious habit of being offline most of the time, but that's how life is. I use my phone very limited hours and then I just go offline. So much so, my mother calls my front office chap and not me. That's easy to get hold of me. So for that reason, if I'm not prompt in mobile, kindly excuse me. I lead different kind of lives and different focuses. Some things I can speak here, some I will never speak in public what I do. But one can be sure, if it is covered, it is for Ayush defense, no doubt about that. So these two emails, if I can be of any help to you. I think as Sanjaya, I have done my part. Dr. Rahul Sir has said, but I would like to be Arjuna, if it is possible, God willing. Thank you very much, all of you who invested your time, attention and faith. I belong to you. I always did, and I will continue to be the same. Thank you. I think it's already overdue. I thought this much I should speak. There are plenty of questions. I don't know how much time we will have, but I know I don't have a second chance with any institution, with any organizer. This much is the limited I should speak. This is the tip of the iceberg that I have communicated, and I could not make it lesser. Thank you, sir. It's all yours now.
Thank you, sir. Thank you, Dr. Sreejit, sir. Wonderful was the session. You have actually, I think you cannot be bracketed into the apron of Sanjaya. Instead, you will become Arjuna soon. Okay, sir. Now let's move on to the product introduction session by Dr. Nair, sir. Sir, please. And after that, we will be having the Q&A session. First with those who have raised the hands. So, sir, please. Dr. Nair, sir, please.
Yeah. Good afternoon once again, everybody. I will take you to a very small presentation regarding Sitaram Ayurveda. You will be very tired or as well as very much knowledgeable after this wonderful presentation by Dr. SP Sreejit. So I'll take some 2-3 minutes out of your valuable time. Sitaram Ayurveda, 100 years of healing legacy. I would like to present few of the products which Dr. Sreejit has mentioned during his presentation. Among our special classical products, Dr. Sreejit was mentioning about Dr. Saudhayan's prescription regarding Sudarshanam Gulika tablets. Yes, we are manufacturing it and we are presenting it at 1 gram tablet. So it's a bigger tablet so that the dose is met with to an extent. And also Hinguvachadi Gulika tablets is also being presented by Sitaram Ayurveda. And also, as Dr. Sreejit has pointed out, regarding Brahma Rasayana, a lot of works has been carried out in cancer treatment, cancer control with Brahma Rasayana. There was a big project being done by Amala Cancer Research Institute, Thrissur. So we are also having Brahma Rasayana and also Agastya Rasayanam, as Dr. Rajagopal has pointed out. Agastya Rasayanam is also among the Haritaki Rasayanams, which is available in the market from Sitaram Ayurveda. And one major area which I would like to present once again to you is regarding our Shiva Gulika, Sitaram Shiva Gulika. It's actually being presented in the Pipitaki Pramanam or Tanika Pramanam, which is mentioned in the textbook. It is mentioned in textbooks like by Shijaratnavali. So we are presenting it as a bigger pills at 4.5 gram, which can be mixed with milk and be taken. So it is exactly at the dosage mentioned in the textbooks, which I believe no other company is doing. So it's the ultimate Shilajidu Rasayanam, which is found to be being prescribed regularly by Dr. C.P. Mathew as well. It contains Javaniya Ganam, Trifala, Dashmula, Gomutra, etc. So here is our Shiva Gulika in a bigger size, 4.5 gram, Vipitagi Pramana, as mentioned in the textbook. with the goodness of Shilajit, Ashwagandha and milk and pill form, and with Gomutra as well, which is a very good Rasayana, which is the best Shilajitu Rasayana available. And now we are also manufacturing and marketing the single herb vegan capsules, and not more to say regarding Ashwagandha. Dr. Sreejit has really and clearly, very clearly mentioned about Ashwagandha and how Dr. C.P. Mathew was prescribing or utilizing the prowess of Ashwagandha. So we are having our single herbs. Ashwagandha is there, and Ashwagandha, all the single herbs which we are presenting is at a stronger 600 milligram extract, again, which no other company is doing. And it is packed in plant origin capsule shell, that is vegan capsules. It has vegan capsules, and it is easy to get disintegrated and absorbed. And it's a regular health supplement as well as a curative, even in conditions like different types of cancers. And it is being presented in glass bottles of 60 capsules. So we are having a list of 10 such items, and among them Amla is also there, and also Triphala is there. Besides Ashwagandha, which is said to be very regularly used for cancer control and treatments by Dr. C.P. Mathew. And regarding the AACHAARA Rasayana webinar series, we have started sending e-certificates to all the participants who attend this webinar for more than 75 minutes. So all the participants might have been receiving that e-certificate since the past 1 month or so. And also we are sending the notes and the recordings to the email ID which the registrants use for registration by the subsequent Saturday. So you will be receiving, all the participants will be receiving the notes and the recordings by the subsequent Saturday. And if you cannot find that mail in your inbox, please check your spam folder or promotions folder, social folder or career folder. And regarding our services, regarding any support from Sitaram Ayurveda, kindly contact our customer relations manager, Mr. Raji. He can be contacted at 90726-13194. I would like to repeat 90726-13194. And he can be mailed at crm.osk@sitaramayurveda.biz. crm.osk@sitaramayurveda.biz. So for any support from Sitaram Ayurveda, kindly contact Mr. Rajiv. Thank you very much. Back to Dr. Rahul.
Thank you, sir.
Dr.
So let us,
Rahul.
Yes, sir. Yes, sir.
I think this is a beautiful section. Is Dr. Meena Kumari. He's a National Institute of Siddha in Chennai. He's a very scholar in the Siddha and the CEO of the National Institute of Siddha, Government of India. She raised a question in 1 minute regarding a webinar. Please call him before the question. Meena Kumari.
Yes, madam. Dr. Meena Kumari, please.
Pranam and Namaskaram to all who is participated in this wonderful seminar. And I'm also fortunate to be a part of in this seminar to see the exact Vishwarubam of our system. Actually, from that doctor, unfortunately I have joined in the middle of the session and missed a little before, and I didn't know this doctor's name. Actually, he explained the strength of our system in the very, very dangerous and dreadful disease of cancer met by our people nowadays in a very large manner. And literally, I feel our system Vishwarubam now. I'm speechless, actually. And bow before the all Siddhas and Gurus who found this excellent system to the mankind to treat their ailments in a very good manner. And I am very much blessed. I feel very much blessed because being part of this system. And I wish I actually wanted to meet Dr. Mathew sir to elaborate about our system in Tamil Nadu also. And we had him in our one Siddha Day function. Actually, we wanted him to come here in person. Due to COVID pandemic, it was not happen. And our team also wishes to meet him in person. Already conveyed this matter to Dr. Mathew sir, and we want to show our gratitude because of his legendary research in cancer with the Ayush drugs, especially Siddha drugs. We are really speechless, sir. We wanted to be a disciple of you, sir. Actually, we wanted to stay in your Gurukulam. I couldn't speak.
Thank you.
Thank you.
Thank you, Meena Kumari. I want to one request also. Our Dr. Sreejit is the last slide. That is some totally wrong propaganda about the Siddha, especially the Siddha, our Kabagudishwar, that products also. So you are the director. You take some action regarding that matter. I already sent the matter to you. What is your procedure? Please, that is also give me a word. That's very helpful for us.
Yes, sir. I have taken this matter to the President NCISM, and he assured me to take necessary action against him through proper channel, sir. And sir, with your kind permission, I want this session again in our for our people once again elaborately to start a cancer OPD. Already there is one, and we want to establish a very special cancer care at our NIS with the help of Mathew sir's input. If possible, if we are blessed, if we are fortunate, we will have that session with your permission and blessing, sir. Kindly guide us, and we are ready to meet and initiate all the actions immediately in our institute, sir, by the name of Mathew, sir. We have to show people, sir. Yes, sir.
Thank you, Ms. Kumari. I want your help regarding that is a wrong propaganda. I already sent that paper. So do you take a quick action? That is very badly affected. That is Sreejit is not the last slide regarding that some people are very badly affected, especially the RASA preparation. That area you want to conscious very seriously.
Sure, sir. Already it started. I have started this action through officials, and I will concentrate on it, sir. And thank you everyone. And we will have you again, sir.
Thank you. Thank you, madam. Thank you.
Thank you so much.
Thank you, madam.
Okay.
Now let me invite Dr. Sarasa, madam, to have her opinion now. Madam, please. Okay, and the last person is Dr. Sheila Kohaj. Dr. Sheila?
Yes, sir.
Yes, madam, please.
Yes. Yes, sir. Very excellent webinar, sir. Kindly continue. I am from Maharashtra, Ayurveda College. Very thankful to all for arranging such a nice webinar. Thank you, sir.
Thank you, madam. And let me go into the Q&A now remaining in the postings. There are different questions, I think a range of questions. And I let me select a few within the allotted time. And Dr. Anjanala Suryanarayana, he is asking about the role of Triphala in squamous cell carcinoma. Dr.
Actually, I would just, Rahul sir, actually, I would just speak what Dr. Mathew sir is doing. As you know, I am reporting, no?
Yeah.
So when it comes to squamous cell, I haven't found him explicitly advising Triphala. He says adenocarcinoma is the villain and tough. Neither chemo nor radiation response. We are very happy with the cervical lining or with the oral mucosal lining, squamous cell being there, and even till the esophagus is getting over, I mean before the stomach. So that's why he finds radiation as the best option to just finish off it once and forever. That is his experience. Triphala, I haven't found him using. See, I don't deny Triphala may be good or bad. That's not my point here. I haven't found him using as a anti-cancer scenario per se. More, he always says that any patient should have three things: clear bowel, you know that obviously, anulom and whatever, clear bed, we know the Agni, and a clear tongue. I mean, we know that coast are reflecting on the tongue. It's very particular. Thus, he would use again nothing with any brand or company. Himalaya capsule is what he uses, and he's okay with any brand. He has no such specifications to anything. So he would say, okay, one capsule morning and evening, one Triphala. That's what the maximum I have seen him with Triphala. So he uses it situations where post chemo and such, wherever there has to be a flush out, he would use Lasix. He uses Gokshura Modaka, agreed. He would use Lasix 40 mg after food, after most chemos, and after most of the chemos may also go for the Triphala like 1 BD, like so that it's cleaned from the system. That is his intention with Triphala. Then getting hold of squamous muscle.
Okay, sir. Another important question is regarding the role of cannabis in cancer. Already you have explained it, but I think the cannabis therapy is coming into forefront nowadays. So a bit more explanation, sir, regarding different products in cannabis and different utilities, its legal aspects also. Please, sir.
Rahul sir, let the entire audience know I am looking at the screen in a very, not frowning, in a squint-eyed manner. Because I'm trying to find questions myself, if something I should make as homework. I'm taking screenshot also because we may not have enough time, so that I can make a compilation, type an email, send to the organizers, and that can also be sent. We may not answer.
Yeah.
So
okay,
my appearance is ugly for this reason. Kindly let everyone know. Okay, so cannabis. So I'm just looking into that cannabis. I haven't found here, but anyway, sir, cannabis, it's a double-edged sword. One thing is that not easily available, but available now. Very has it and many have it. Legal issues are there because it is there, but then it is safe because we are buying from a certified and a bona fide supplier. Sir is using it very extensively because he is convinced of its anti-cancer effects. At the same time, he has a very clear, like he would withdraw if the patient is not favoring it. If there's a lot of challenge happening to the health and many other problems happening, hallucination, the list is long, extremely restless, and so many things are going against in terms of response or the reaction by the patient, then he will back off, basically. And then he has somebody in, they call Sagar. They are like in Bombay side. There's address and phone number, everything there, which Madam Jasmine can also provide, who have the indica, the very strong, and very small is used, but that has great effect. But not everyone is able to accept it, actually. That is a problem. So that is why it is not the only painkiller solution he has. So that's why we have to depend on the homeo drops also. And this is why I would say it is great, but we have limitations depending upon the patient's response to it. It's a good painkiller. I've seen people using up to 6 and they feel a lot of relief with pain. And I had a struggle in that when the cannabis was not available for more than 4 or 5 months. That's why I went into homeo. Thankfully, that was a great learning lesson that even homeo drops can also help.
Okay, sir. So another important question I noted is the use of AACHAARA Bhavida Pipali, Vartamana Rasayanam. Can you, do you have any experience?
I have no experience. I never heard anyone doing it. I personally don't have experience. It's totally out of context. When I did Kuti Pravishik Rasayan on May 2014, my mentor, Dr. Sir's name is Raviraj Kadle sir. He's from Kumta side, Kadle village, Karnataka. He did this parasha on me. So but that is totally Kuti Pravishik Rasayana, nothing to do with cancer kind of intention. And the patients I have done in AACHAARA, I mean in our place, Kuti Pravishik Rasayana, our patients, they had no cancer scenario with it.
And sir, Dr. Arshad sir has asked you, could we practice intravenous infusion of Ayurvedic formulations? That's another interesting question. Previously, I heard it was there, but we lost that practice.
Is Dr. Arshad the sports Ayurveda specialist?
Yes, I think so.
He's my brother. He's my brother. So we are very proud that he's part of us. So I think he could have asked it personally in WhatsApp also. Anyway, I already told Dr. Vignesh yesterday that kindly invite our brother Dr. Arshad also to this kind of forum. Anyway, this nobody is currently doing it. Currently nobody is doing it, but he has given me inputs on this. I think we can always take this practice to a higher, I don't want to say this is lower now, but a different level. Currently not in the circles we know of. Dr. Harshad has some papers from China, and where they have documented very well. So currently it is not happening in the circles we know of. But I think we will have to open new avenues for sure.
Okay, let me invite Dr. Mukunda Kumar, sir. Sir, please talk, sir. Please unmute and talk.
Again, one of our brothers. He is a student of Dr. Shankaran, sir, just as I am. So Mugudetan had, I saw it now only, Mugudetan had mentioned about Yavanya, which he already had taught me. Mugudetan was very, sorry that no, we have a lot of brotherhood in our faculty, so others don't take it as unprofessional that I'm not using the word doctor. No, they are all our own people. Before he tells it, I don't know if our friends have noticed, Mugudetan has mentioned Yavanya for the CA lung, and I have learned it from him through a WhatsApp group of Dr. Joman Joseph Daniel. It's called Coffee Group, and he has the maximum experience of cancer because he was with Shankaran sir for almost 6 years, 6 or 8, where I did not put here the Shilajit Rasayan or the Bhalatak Rasayan because these are the knowledge I learned from Shankaran sir, not through the patient, but it was done. So I have the paper only with me. So I kept quiet on that topic because I don't have photos of those patients or whatever like that. I only have the photo stats. So that is one big area where we can contribute with this Shirajit and Latak. That what I would call as a regimental IPD level. Whatever I have spoke here is all OPD level. So anyway, let us hear from Mukund and what he has to teach us.
Dr. Mukunda Kumar, please.
Hello.
Yeah. Doctor, please.
Sir, good afternoon, sir. Sir, very nice discussion, sir. Actually, my mother is suffering with breast CA, sir. From 3 months, mastectomy done, sir. She is now under chemo. Next is radiation is there, sir. What preventions we should take, sir? She is after 4 chemos, is suffering a lot with pains, sir. Hello.
Yeah.
Hello.
Ma'am, actually, yeah, Dr. Mathew sir's approach is which has happened, so that's how it is. And then do chemo if surgery has not happened. Get the mass reduced in a matter of 1 to 2 months, but definitely by 4 to 6 chemo OPD sessions it does come down. But in this case of hers, it is already happening.
Okay.
So he generally doesn't prefer chemo.
Okay, sir.
It's already done. His logic is the mass or the lump or the lesion was supposed to be brought down by chemo and hormone therapy and AYUSH to take over it.
Okay.
But here, surgery has already done the task. Chemo is harmful. So if supposing there was a reality that today you are meeting Dr. Mathew sir, if that was a reality, he would have not taken up the case matter and he would have requested kindly stop the chemo now and then come to me. Then only I take up your matter. So supposing if you had done that, an example sake, he would definitely go through the prescription that I had mentioned, which is fairly overlapping many a times. That would have ashwagandha, which will have purna chandra ras, it will have aloe vera, vitamin C, aloe vera juice and vitamin C like 2 grams to maximum 5 grams powder. It will have the purna chandra ras. All of them have different functions that we next intend, our intention and wish is to prevent metastasis from happening.
Okay, sir.
So because the fact is we have to ensure that the further damage to the health is not happening, because with the chemo invariably the immune system would go for a toss, regretfully so.
Okay, sir. In between, sir, I think one of the best books which we need to read for practicing oncology is Mavelikara Kunjiraman Vaidya's book Chikitsa Siddhantangal and Chikitsa Anubhavangal. He has mentioned a lot of formulations which are very useful. And with the help of Dr. Vibhu, his grandson, I got an opportunity to prepare Gugula Tiktakam Avartanam Kashayam. That it is a 3-stage preparation, and we are now giving it in Ashtanga OPD to cancer patients. And some benign lesions. Like I got an opportunity to give it in neurofibroma, and I could see that the size is shrinking. So I think that book is a treasure trove for those who want to treat this the area of tumors. But we people have forgotten him, I think so. Kujanam Vaidya is such a legendary man in that arena.
I should blame myself on this. Vibhu is my just a junior in my college. He's our again buddy like Jomon and we all one bunch of chaps. We also have so much of this. I wonder, we have spoken so much of things under the sun. Why the hell did I not even talk about this book yet? So I think today itself, with immediate priority, I will call Vibhu and start learning. And thank you very much for reminding this reality, because it's my fault. I mean, Vibhu I know for like since 1997, and what a shame that after so many years also haven't realized that. I know his grandfather was a great Vaidya. We have all respect for him, no doubt. But I think what a shame that I did not know it so far. So it is time to introspect for me.
So let me invite Dr. Mukund Kumar sir again. Sir, please talk, sir. And I think some problem still persists. And we have got Sarasa madam with us, who is having long experience in treating cancers. Madam, please. Sarasa madam.
Hello.
Madam, please.
Hello.
Madam,
can you hear
please.
me?
Yes, madam.
Oh, anyhow, very nice discussion. I like it very much. And something I have to say, in my experience, I have treated so many cancer patients. In lung disease also, I have given my Tribhaladi Rasayana. It was my PG thesis drug. It is mentioned in Arogya Kalpadrima Vrana Pradishedha. Hello, can you hear me?
Yes, ma'am.
Yes.
You have done very nicely. Hearing from beginning, but in some time I had some problem with my network. I done my PG in Trivandrum Ayurveda College with the guidance of Dr. V.P. Gangadharan and Dr. Shyamala Kumari, then professor in Sastavutta department. With some yoga practices also, I am treating the patients, getting good results. And how most of the patients coming to us after chemotherapy, radiation, like that. But my PG study time, I selected NHL patients without allopathic treatments, but have given very good results. And so many patients came to me after that. This drug itself I am giving to some other patients also with other our medications according to our the patient's condition. With diet control also. Tribhaladi Rasayana is Madhusnihi content. And Vilyadi Guliga also giving some good results as a supportive therapy. So you can try this also.
Yes, ma'am. One of the reason, sorry, I did not mean to interrupt you, for me to come to this forum was to seek the lot of filling the blanks. I am yet to fill the blanks, lot of missing links. So my coming to this audience was not as a presenter, but to be a learner. I know there are many great like yours with a lot of experience that I am not personally aware of would be there. So that we can contact them with all respect to their credentials, with acknowledgement. We can bring these to the domain of knowledge of our doctors and also to the public step by step. So for me it is very enthusiastic to know that in non-Hodgkin's without chemotherapy things can be done, because Dr. Mathew sir is using chemotherapy, which I have seen, which is and I shared a little bit also. So it is a great encouragement, and moreover when you have done at a sustained and a documented manner, it just adds to more comfort for us to try that. And I think I will request either Dr. Vignesh or Dr. Rahul sir that
Sir, please.
once
I
I get
took the patients from RCC.
yes ma'am, yeah. So
Dr. Gangaran was there at that time.
yeah. So whenever I get your contact details, I would just call at your convenient time, and so that I can learn and we can spread this message to many. I have access to more than 2,200 doctors on a daily basis. I help them. So we should all know that our people are doing or capable of doing. That will help us to at least refer, if not to treat directly.
Okay. Actually, I think I am the first doctor going to RCC and giving such medicine for as treatment, not a supplement.
Yeah. Actually, we need more people like you, ma'am. More the merrier. That's what I would say in these aspects.
Okay. I will give as what can I can.
Yes, ma'am.
Support
It will
you.
help us a lot.
And I am admitting patients also here after retirement.
Okay.
Okay.
Yes, ma'am. Thank you. Thank you
You
for
can
stepping in and
continue.
guiding us. Yeah.
Dr. Sreejit, Dr. Rahul just informed that there was a technical error with his internet. So, Dr. Sreejit, I mean, when you go through the questions, I mean, we are also running out of time, and it's been long. Can you identify some of the key questions that you feel make sense to answer? Because many of the questions you already answered in your webinar. So, if you take some of the key points, that we could answer that. And also, there is a lot of question how they can join your group of learning.
Yes.
So if you could post that number, that will be fantastic.
Yeah, I think I don't know if I can type for here. It's called.
No, I already posted your website. So maybe if you can.
Yeah, actually, it's 07093245. So I am writing here Telegram. Actually, the number, this one is a Reliance number, and I put +91 for the sake of the Indian code. That is what I put there. 8075093245. I don't know if it's visible to everyone. Let me see this now. Telegram group for cancer. I put like that. So they just have to send a Telegram text. Cancer training. Well, training is a too big a word. So please send Telegram text only. Then it is more sharp. Because WhatsApp is always crowded everywhere. So please send Telegram text only. That will help us. I will simply add, and what happens is the things which are already there for more than a year or two, it all will be automatically with you because you're joining by Telegram, unlike WhatsApp. That is why I opted for Telegram to have that backup already there as a history there. Text only, and I'll put like most welcome. Okay, so it is there. I don't know if it is visible to everyone.
Yeah, it is visible. It is visible. It is visible.
And hormone therapy useful? Yes. CA breast with after lumpectomy? Yes. Radiation with all side effects? The alternative in Ayurveda for countermeasures? Yes. Definitely. I mean, it's very simple. The disease part is already done by the allopathy, by radiation, chemo, surgery, whichever. Then we are left out managing the patient than the disease. So the typical more than the Vyadhi Karshita is the Aushadha Karshita scenario for the patient actually. That makes it relevant that post radiation we have to go by the symptoms bothering the person more than the disease per se. So wherever we need a tongue coating that is pink, we need a clear hunger happening, we need a good sleep, Ashwanda gives that, we need a good sense of mind and relaxed emotional situation, Manasi Mitra helps quite a lot, and then we need a clear hunger and digestive system which Vaishwana would do quite a lot. So that is how we have to go system by system effect to get that quality of life come back, and not forgetting what is called as the onco psychology or psycho oncology. That was about the radiation. And I see Moderator has mentioned chemo time also we can support. Obviously, yes. Plenty of great effect by Chavanaprasham if the hunger is intact. Plenty of effect by Ashwagandha, Guluchisat, Drakshadi Kashayam. It's like you are roasted, no? After chemo radiation, you're literally roasted. So that Vata Pitta Hara situation is always needed. But we should not make it generalized. We need to be very specific. There may be situation you are needing Punarnavadi because that is an edematous scenario. There may be situation that somebody will say vaile kaipu. Many patients they keep on telling after chemo and such that vaile kaipu ruji illa. So allopathy may not really address it or take it seriously, but we know Pachanamritam is relevant there, or we know Amrita is relevant there, or nothing else Sudarshanam is relevant there. That is the way we have to get into it. And name of the publisher, that's already there. And there was somebody who mentioned about mantra and that group of entity. That is, the idea is that, well, I follow Agnihotra, but Dr. Mathew taught me that. But obviously, the Mahamrityunjaya mantra is a great use, no doubt. But that is for the patient also. But for our own, shield, because we are emotionally drained when we involve with that intensity, I prefer the Panchakshari Namah Shivaya and many others also. So I don't know how much it is appropriate to speak in this audience, but it's our faith and our methods, and doesn't have to be Hindu mantras. You have so much of religions and so much of practices. It's your call on that. Useful in radiation-induced oral mucositis, yes. What Dr. Mathew normally tells about post-chemo, if not radiation mucositis, he tells a lot of dahi. It may sound a bit contradicting, I know. Dahi is Ushna and Vidahi, we understand that. But his idea is more towards the vitamin B and B complex scenario. So most of the people with vitamin, because it's a B complex, most people feel good with the syrup. However, there are people who don't find relief with syrup. You start the tablets, in a matter of second day or third day, they feel better. By third to fourth day, the symptoms start to decrease, that mupe chale, that those kind of apple salsa kind of thing. By 7 days, they're kind of out of that, nearly. And I make it easy for people, this Mahatikta and Devam cortical has, or many people will have. So just easy, anyways, the Tiktaka is a situation, as Dr. Rajabal sir has taught all of us, that Sukritan Pitajan Gadan, Tiktaka, the indication comes, Kashaya. Same way, if the ghee is applied, it has Nellika anyway to it, the Rasayana property is there. It's very handy. So we tell them start using it much in hand, beforehand, even after it. Nothing available, plain ghee. If that is not acceptable, that some say cholesterol, this and that, we say plain honey. Still okay, something better than nothing. And if we can trifle with it, it's fine. We can tell so many things to patients, but their acceptance, they're so fed up. Why I'm living? These things they will keep telling us. Then you have to make things which are friendly. Yes, sir. Rahul, sir.
Dr. Rahul, sir, is he has some technical error. So I think we can now slowly wind up.
Yeah, anything they can send an email. So if somebody feels like, and they have my professional number also.
Sure.
So
and please do visit the website agnivesha.info. You'll get all the details what Dr. Sreejit is documenting.
Plenty of things are there.
Yeah. So Dr. Sreejit, it was, you took the position of Sanjaya, sometimes Arjuna, and sometimes Krishna also, for all of us in different various aspects. It was a true inspiration to see, that you're a student of life, student of Ayurveda, student of every healing science. You went from what is possible with Yukti Vipasraya to Deva Vipasraya to even to Sattva Vijaya. Every aspect was covered in such a fantastic manner. And more than that, a confidence that being an Ayurvedic doctor, the possibility is just endless. And you're not just limited to what is available. So to all the listeners, we will be sending you the recordings of this the coming Saturday, and with the e-certificate also for that. The next Sunday, we have a talk by Dr. Janardhanan Hebbar on how to take your Ayurvedic practice in the online world, especially with the COVID, with many lockdowns happening. I think I really request many of you to join this to understand what are the possibilities in the online world. Not just, if lockdown happens, if nobody is coming to the clinic, let us not be stuck. There is a possibility of doing a lot of online consultation to how to take it further. So please do join. And once again, thank you, Dr. Ragesh Thiran, for doing the product presentation, Dr. Rahul for doing the moderation. And once again, Dr. Sreejit, Yo Apurva Vaidyaya Namostu Tasmai, for all the things that you're doing. Thank you all.